Stephanie will take care of that. There we go. That's better, isn't it? Yeah. And the taping, it would have muddied all that up, wouldn't it? Right. Just going to make a little more room here. All right. Good morning, everybody. Thank you, Councillor Pearson, acting deputy mayor, I should say, as well. Just wanted to clarify, Michelle's here with me this morning. As you know, I'm still adapting back to work, and so Michelle's helping me out by doing part of the presentation this morning. She's going to do the division section, which comes at the end, so we're not going to have all the directors up here to do those parts. I'm going to do the overview components, and then Michelle's going to move on and just do the detailed bits at the end. So we're going to go through in the usual sort of manner. You've had a couple of budget presentations already, so you know the format. Ours is very similar to that. There is a fair amount of detail too that you'll see in the slides. I'm not going to go through all of the detail as we speak, but certainly if you have questions that relate to anything that's in there, we'd be more than happy to answer those as well. So looking back at 2015 and what we accomplished in the past year, there's just a few things I'm going to highlight. And I know, Councillor Green, you've asked some questions about lean and have given us a heads up that you wanted to understand what sort of initiatives had happened there. So thank you for that. And I'm going to highlight some of those as we go through as well. So our consolidation piece was a big piece for us this past year. So as you remember, we had been moving into both the David Braley Health Sciences Centre across the road, as well as consolidating the last bit of our staff from Healthy Living up on the mountain down into the Robert Thompson building this past year. So that was a big part of the change for us. We also had our clinical services extended in the downtown consolidation with both tobacco and sexual health, and our breastfeeding clinic was opened within the McMaster Family Health team as part of those changes as well. And this is part of where the lean piece comes in. Part of the reason for consolidating and looking at a different way of doing work was to look at whether we could use hoteling and a more community-based model of providing care in order to improve the amount of service we were actually providing in the community. So what that means is that by not having staff have to come into the office to document or for requirements to be in at the beginning and end of the day, we could have them actually out in the community providing service. And with our Healthy Babies, Healthy Children home visiting program, you can see that we did have an improvement in our number of visits from 8,000 in 2014 to 8,175 in 2015 in our first year of implementing that new model. And so we're going to continue to be following that and to see if we're able to sustain that, but that is taking us closer to the targets that the ministry has set. Within prosperous and healthy community as well, under that part of our strategic direction, we also had an enhancement that Council provided last year in the area of air quality. So just wanted to highlight what it was that particular FTE had been working on in the last year. And they did help out on the Community Climate Change Action Plan, which you know was approved this past year. They also managed the operation and data reporting from our two new city-owned air monitors and delivered health promotion campaigns on wood burning and outdoor wood smoke, which had been a significant issue over the past couple of years, as well as radon awareness, which has been a sort of ongoing issue in the background across many parts of Canada. You'll recall, of course, the PFMSI. That was a big piece of work for us in terms of both the review and the work that we did with planning and ECDEV and legal and all of the people involved in that review. And as well began a health impact analysis, which was a new piece of methodology for us to be using as well. So that was a significant initiative for us. You'll see the bedbug strategy with community emergency services, which was consistent with that overall sort of piece that Council looked at with capital financing as well around housing and improving housing in our community. And we did all this while having 3 activations, which is more than we've probably had in a while, all in 1 year, but 3 activations of our Public Health Services Emergency Control Group around another measles outbreak, McMaster meningococcal case, and then finally, what you've probably heard about on the radio again today, is raccoon rabies, which began at the end of the year last year. So we've made some improvements again, even in our emergency response process, to have a smaller activation, a leaner sort of process, and quicker responses, and that's improved as well. Ebola, of course, we can't forget that happened last year, and a lot of work was done within the health community around surveillance and planning, and raccoon rabies I've already spoken about. Hamilton Healthy Kids finally got underway. We've been waiting for that one for a couple of years, particularly, of course, for 6, 7, and 8, Ward 6, 7, and 8, but it will have implications around the city as well. Formal launch for this, just to flag for people, will be February 13th, right, Ellen? And so we're looking forward to that and a lot of the work that's going to happen there. It's a really neat piece of work. We've got 20 different players from across all of the partners that go through education and skill building for children, program, infrastructure, and they're working on all kinds of initiatives to it. And it was great to have a quote from one of the rec staff talking about how this really did feel like a night where everybody could come together and work on these issues together and get some traction on them. So we're really looking forward to seeing how this continues to roll out. The food strategy, of course, was also a big piece for us, and just really evolving the way we do work around community engagement and adopting the learnings that we've had from the Hamilton Community Engagement Committee and all of those things to better inform how we're thinking up these major issues in our community. Next is healthy birth weights, and my favorites, you hear me talk about it a couple of times this past year, particularly because this is focused on an important issue in terms of decreasing low birth weight in the community. But it's also very much led by young parents for young parents. It's about them talking to us about how they want to see their care and how they want things to happen in ways that work for them. And so there's a lot of work done on this with a number of different partners engaged across the health services and support communities, and some really good stuff out there. Our BFI is an indicator that we're moving towards. A lot of work goes towards this one. I'll come back to just touch on it again in the indicator section of this. And one other piece that's another CQI initiative has been the implementation of a plan to increase screening prenatally of women who are at risk during their pregnancies. And with the work that we've done already so far, we've increased it from the screening by others. So this is even harder because we're not trying to increase our own rates. That's a little easier. We have direct control, more levers. But when we're working with all those partners out there and trying to help them get those screening rates up, we've managed to get it from a 2 to 3% screen rate to a 7% screen rate in the past year, and we're aiming to get to 10% over the next year by the end of 2016 this year. Preparation for transition to new integrated dental program for children under Healthy Smiles. You might feel like you've heard a little bit about this often from us over the past 5-6 months. This is an initiative, of course, to bring 6 different social dental support programs together under one and provide access through one system for everybody in Ontario who's in need, and that's taken a fair amount of time. You're going to continue to hear a little bit more about that from us over the next Board of Health and whatnot as we just get the final understanding of what this means for us financially as well as organizationally. Our seniors oral health outreach program, you heard from us about the last Board of Health. We've put together that piece and then are just sorting through the treatment side. Under mental well-being and resilience, you know, the top priority that we've come out here again is youth mental health. And we've been working with our school health action teams and looking at issues of bullying. This has really come to the top as the issues that they want to address. So as I said, particularly around both bullying and school climate, connectedness, those sorts of issues. And so we've got, I think I'm not sure what the total number is, but 30 schools involved in one and 25 in the other, but some are involved in both of those initiatives. So a lot of uptake, and that's exactly what we've heard from the principals and the board directors, is these are the significant issues that they're finding in their schools. Records management, you may recall, probably it's about 1.5 years ago now, We came before you to talk a little bit about the fact that this had been a challenge for us. We really needed to make some improvements in terms of our records management. It was part of what we realized as we brought all of our records together through the consolidation process that we had some variability in terms of how we handled things, and we wanted to improve our consistency and move to a more streamlined approach. And we've spent a lot of time looking at that. We've had a consultant in to help us to understand where we can best improve on that. We've changed, as you know, our administrative structure, and we've dedicated staff to this particular issue, whereas it used to be one thing among many that our program admin staff would do. And they have done yeoman's work. I was just talking to Joe Salmon, who many of you might know, but he's now the manager in this area, and he was talking about how they have managed to get this consolidated down to less floor space, down to less files, better organized, and they've just done a ton of work. It's 75,000 files that we're talking about. It's you know, a huge amount of paper and whatnot, and improving our work with it. So we're really, really pleased with what they've managed to do in the past year. There we go. Leadership and governance. So the one to highlight here is our Pan Am Games emergency response planning and coordination. And so, you know, you'll hear me talk about PAM a couple of times, but Pan Am for us was one of those things to be really well prepared for. There's a lot of work to do in terms of supporting the food premises, the inspection process, and as well coordinating the emergency response and the having vital staff on standby throughout it. So this piece was a large initiative for us, and as you'll see as we go into the indicators, you can see where it caused a bit of pressure on our services as well. One of the other neat things that happened with that was harmonization of the heat alert system across the province, and so now we all talk about it in the same way, and they largely used our system to develop it. We were very pleased with that, both that we've shown that leadership had a good job, but also then didn't have to adapt so much to a new system. That's good. So here's the indicators section. So these are indicators that hopefully you recognize from reports you've seen in the past. So these are the indicators that the provinces set out for us, and there's two types of them. There's performance indicators and there's monitoring indicators. So the performance indicators are where they're actually setting targets for us for what they want us to do. And what they have done is set targets for a period of time, asked us to improve and to report on any issues in terms of not being able to perform. And then if they're satisfied with where they're at, they move them over to the monitoring ones. And so these first ones we're looking at are all of our performance indicators. What we've done for you is codified them with color, and so everything is green are the ones that we've met, that we were required to do, and the yellow one on the left, which happens to be at the top, is one where we have not met this particular performance indicator, and that's around tobacco compliance with youth access. And there's been some issues in the past year with the way, and Ellen I may need Ellen to explain it a little better than I, but essentially issues with the way they're doing tobacco compliance, and the province has changed some of the ways they want it done, and so we've had to change that process as well, and it's kind of put us behind. All of these other ones we've, as I said, we've met. One of the ones I want to highlight on the next one, you'll see we're not quite as all green here. We've got 3 of them that we haven't met on this section. The suspected rabies exposures, and you might be thinking, well, isn't this a good year to make sure that that's happening very quickly? And Rob's team is on that and getting there. The salmonellosis case follow-up, it's about where one or more risk factors is listed other than other. In other words, that we're doing a good job getting the information and entering it. And so we're looking to see how we can improve that. And the last one is the % of influenza vaccine wastage. And that's one where we need to look at how we're doing that vaccine handling and where the challenges are in that, how much of that is about a recording issue as we've gone through different databases and systems over the past year, and how much is really about a handling issue, because our suspicion is it's really more about data than it is about actual vaccine handling. The rest of those, again, on the performance side, we were able to meet. I'm going to switch over to the monitoring side. So these are monitoring indicators. These all were once performance indicators, but where we or the province in general had been generally doing okay, and the province was ready to sort of move those to the side and say, we still want to track them, we still want to see how you're doing, and we want you generally to maintain your level of performance or improve it, but we aren't going to be, having the same level of target setting that they have with the performance indicators. So you see here we've had a bit more of a challenging year in these ones. So the 2014 indicator is shown there in the one column in our 2015 performance. This really, when you look at particularly at the percent of high-risk food premises, this is where those pressures and some of the Group A follow-up, whatnot, this is where some of the pressures come in about we can do the work as long as nothing else is happening. We've got the resources, we can do those things, but once we start to get those added pressures, when you get a Pan Am that comes in, and despite us having not allowed staff vacation in that section from, I think it was June through to the end of Pan Am, or was it May, Rob? June through to the end of Pan Am, reorganizing schedules, changing how we do things. Between that and as well those measles, raccoon rabies, all those other incidents, it becomes hard for us to maintain. You'll see there's no major declines that we're talking about. It's just we're just at that border of maintaining it when we have those added issues.
Dr. Elizabeth, if I just interrupt, just because I've just been advised, every other slide is missing in our presentations here, so I'm just getting questions asked, but proper copies are being made now and will be distributed. Thank you.
Thank you for letting me know. All right, we'll get those fixed up. Next piece is talking about the Department Operational Work Plan priorities for the next year. And you'll see on this slide that the health systems integration piece is at the top and starred. And you heard from me at the last Board of Health meeting about the fact that Patients First had come out, about the OPHS review, the OPHOS review, and all the things that they're planning. If you'd seen this DOWP, which we'd worked up before that date, you would have seen that wasn't at the top of the list. And what we've had to do in terms of looking at the issue, the significance of Patients First and what it means for us, the expectations around dialogue, feedback, all of those things, not just on that particular document, but now on all of the Ontario Public Health Standards, on all of the organizational standards, a new working group to sort out Patients First. We really need to spend a significant amount of time this year focusing on what this means. How do we do this constructively going forward? How do we figure out what these new things mean for us? So that's where now you see that we've had to shift resources to some extent to that, more so than we had planned. The other things are still very important things for our community. The Healthy Kids Community Challenge, food strategy, mental well-being and resiliency. We're just going to have to adjust a little bit as we go through these, and some of them may be a little bit more operational than they once were. So that's just wanted to highlight that as we look at the DOWP. We then give you our internal priorities. So remembering we always give you external and internal. What we're focusing on to improve the organization is the internal, and the external is what we're doing on to focus on public health in the community. Again, we had three things that were here. Our culture, and this is part of the broader corporate initiative to try and improve the culture within our organization as an employer. And so we have a group of about 20 staff across multiple parts of public health who are working on this, how can we continue to improve things within our organization. And I had the good fortune of being there for half a day with them last week, and they're just a fabulous group of staff who are working on it. And the whole thing about speaking truth to power and all those sorts of concepts, and we're really looking forward to the advice they give us on how we can continue to make this a better workplace. The records and information management continues to be a priority to finish off the good work that we've started and move to an electronic record system in many of our areas and other improvements. And as well, we're continuing to work on the talent management piece. Again, all of these things, just from that priority piece with the health services integration, the OPHOS review, remembering that the public health organizational standards particularly address some of these areas, we're having to just think about and adjust our investments as we move forward. Okay, on to numbers. And would it be helpful to just take a pause there about those sorts of concepts, or would it be better?
I do have two councillors that wish to ask questions,
Okay.
so that might be appropriate. Thank you,
Yeah.
Dr. Elizabeth. Councillor Johnson, Brenda Johnson, and Councillor Green.
Yep, thank you, and thank you, Dr. Elizabeth. I just wanted to ask a quick question about the raccoon situation. We all understand that there was another 10 cases that were found. The ministry were quoted as saying that they felt confident that they were targeting the correct areas. So when you put down as one of your budgetary issues, my understanding is that the ministry has taken full carriage of this file. So can you please enlighten us what is the staff here at the City of Hamilton are doing as well?
I'll turn to Justin Robb.
Hi, good morning. Thanks very much for the question. So in terms of the role of public health shares some responsibility for rabies along with the provincial ministries, so OMAFRA as well as MNR. And so we have some roles around following up on anyone on any human with an exposure to a potentially rabid animal. We also distribute rabies vaccine to the community as needed for any post-exposure prophylaxis.
Thank you for that answer, and through you, Deputy Mayor. I'm sorry, I've forgotten your name.
Jessica.
Jessica, thank you, Jessica. Jessica, so far, my understanding is no humans have had any contact. There's been no danger for the humans. So would it be fair to say that right now it hasn't been a budgetary pressure right now because there hasn't been a need?
So in terms of what occurs, so there is follow-up that happens anytime there's a potential human exposure. So we've had fewer than 5 of those associated with the raccoon rabies at this time. Now, this does require, less than 5 doesn't sound like a lot of cases, but each of those requires quite a bit of follow-up because we need to do a risk assessment. So we need to understand more about the animal encounter that the person had, how the animal was acting, as well as any potential human risks. So is the person immunocompromised? What medications are they on? Other information like that. So that does involve follow-up, and it involves coordination with the hospital or with the other healthcare provider that might be providing post-exposure prophylaxis.
Thank you for that.
Perhaps I could just add a comment as well. When we're talking about from last year's perspective in terms of pressure on the staff, it's part of that at the beginning in terms of understanding it is back to the whole piece about understanding what's going on, what's the planning, what's the degree of surveillance. There's a number of teleconferences because the ministry speaks to the animal health side of it and we speak to the human health side of it. And so we have to work with them in a very coordinated fashion to understand what they're doing, how they're carrying that out, where they're planning to do the baiting program, what their surveillance strategy is going to be, and then continue to connect with that. And there's been other health units experience that has been much more extensive, I would say, in terms of their involvement around that piece. But with the experience of those and now clearer roles and responsibility, I think we're able to keep it at a level. But it does cause more work that we have to respond to.
Okay, thank you for that, because I remember at one budget meeting, Legionnaire's disease was quite the issue at that time when we found things in air conditionings, the whole bit. So I'm just wondering, is there a certain team that is set up to deal with these crises, if you will? So this year it's the raccoons. A few years ago it was the air conditioners. A few years ago before that it was the West Nile. So would it be fair to say that the budgetary process, it doesn't fluctuate that much because the crisis, although maybe different name and a different protocol, but there is still that core that deals with these ongoing new issues, old issues?
Through you, Madam Chair. I think you're absolutely right. Like, these are issues that we deal with in one area or another flares up at a given time. And so if you think back to what we've done in the past year, measles, raccoon, meningitis, there would be different teams who have the expertise on those issues. And then when a larger issue comes up, they need to focus on that issue. And they require support from other parts of the department to do that. And then as it quells back down, we can focus on those things. And so just in looking at these things, you can see, because we have to redirect some resources, we can't staff at a level, it wouldn't be appropriate for us to staff every team at a level where they could do each emergency. And because of the expertise required, we need to draw pieces from different parts of the organization to do any one area. so that there's multiple areas that get affected. We don't really have just an emergency response team that waits to do this work. They're doing other work and then get pulled into it.
Okay, thank you.
Coming from.
I guess my question is, if these teams come together at needed times, where does the budgetary pressure come in if their existing roles, if they, they may divert their attention to a certain area for a certain length of time, but the money, does it not still stay consistent along the way, or are you spending money on more staffing to address these up and coming issues?
Through you, Madam Chair, it depends on the particular outbreak. So mostly what I'm highlighting here is the pressure on the programs, not a budgetary pressure.
Okay.
So the pressure on the programs is that because they've been pulled to do this, they can't do that.
So it's fair to say that we haven't hired people, we haven't brought in resources from outside the department to pay for them to look at certain things such as the rabies.
Not for these instances here. We have had incidents in the past where we have had to do that.
Right, but not this year.
Not in this past year.
Thank you. Those are my questions.
Thank you. Councillor Green?
Thank you very much, Madam Deputy Mayor, and I certainly appreciate the presentation as it clearly identifies not just initiatives but places where there needs some improvement. So I totally understand that, and also recognize, Madam Deputy Mayor, the identifying of key places for integration. My question relates specifically to records and how we might be able to, through further innovation in open data, strengthen our partnerships with our key institutions, McMaster, Mohawk, Redeemer, all the hospitals, obviously, in a more open way to allow that information. That is, obviously, Madam Deputy Mayor, the stuff that is allowed to be out given the privacy requirements. I'm just wondering if you can comment on the work that you've been doing with the neighborhood action strategies, the schools, and just where we might be going in terms of that nexus with open data, information, and public health.
Through you, Madam Deputy Mayor. The piece about records and information management for us that we've been focused on is more about how to move from paper to electronic. And that's a huge piece of getting to a place where you can even start to think about open data. And we have a number of different data sharing agreements with all sorts of people who want to share data with us. There's everything from ministry-based ones, right, where they're trying to understand, the public's health across the province, to academic institutions. The hospitals, of course, are another big place where we're sharing information back and forth, and different partners. So a good chunk of what we have does fall under that stuff that's private. It's health information, personal information that, can only be shared in certain forms. And we're pretty far behind in terms of getting things from paper to electronic too, which makes it kind of challenging to even start thinking about how do we get that out there. In terms of the broader, the more health status pieces of it, there's work that we do with different parts of the organization. I mean, QUAB is doing a lot of leadership on open data and where is that going and where can it go. We work with CES on sharing information and getting to provide the stats and data that are needed to support those things. I think we have a lot of growth to do as an organization in collecting, organizing, and turning things from data to intelligence. One of the things that you see here with the service level indicators is you don't see as many of the process indicators that you've seen in former budget presentations, because those are just data. They're not telling you the story. And so we want to come back and talk to you more about the story that is behind that data rather than just give you numbers that don't have all of that added information. And you're going to see there's work that we've been doing across the department to set out more indicators, monitoring, so we can bring you back the intelligence, not just the data. Open data, I think it's been a challenge, though, for us as an organization, both because we have this privacy thing and how do we deal with it, but then how do we take that a step further? And we're really looking to QUAB and that section from the CMO to really help us to understand how we can take that to another level.
I can completely respect and appreciate that, Madam Deputy Mayor, through you, given the nature and the time requirements that it would take for FTEs. But I guess what's still left for me with regards to some of the lean conversations, the nature of open data, is that there might be an opportunity to have a shared responsibility in the community where these data sets are released and they're organized organically, which seems to be certainly not any of them that are through any privacy lenses. But I do recognize the work that's happening through the neighborhood action strategies in the schools, and it's been feedback through me, Madam Deputy Mayor, that that there's great opportunities there, and there's a great sense of the city and public health coming into our communities. However, one of the shortfalls we have is sometimes with, and I've brought this up in the past, so I won't go too far into it, sometimes the information sets, how we're informed on policy here at City Hall, doesn't necessarily include the public. So it could be sometimes seen as a one-way exchange where we're coming and being studied in our neighborhoods. There's been some conversations there, some people feeling like almost a little bit of a zoo in terms of being spectated on and reported on, and all these studies. And not to mention the the work around Code Red and what that meant for our neighborhood. So I guess in a communication strategy, Madam Deputy Mayor and members of council, in a communication strategy in partnership with Community Emergency Services, I feel like telling that story, turn the data into intelligence, will provide this department and, of course, the corporation a huge opportunity in integrating our best practices with engagement, community engagement, and so on. So I appreciate the presentation as it's been presented and look forward to the budget side, keeping in mind that lens of the more people we can get involved in these processes, the less it's going to cost us in terms of FTEs and everything else. And so I'm just going to put that out there and look forward to the rest of the presentation.
Thank you. No further speakers? Go ahead.
All right, so into the budget section. So the classic slides that you're seeing around organizational chart, and we've got a few slides in here that address some of the questions we classically see as we have been asked in other budgets, so we've got them up here proactively for you. So first of all, just with our organizational chart, you'll see that overall we're at just a few less staff this year than we had in the previous year, about 3.4 down. As always, there's a bit of fluctuations in that. A number of those decreases have actually been because secondments have been ending with other organizations that have usually asked us for staff that they can employ and use within their organizations. And you'll have seen reports come through on each of those, things like some of the discussions we've had around NFP, the family health team, those sorts of things. You see as well the change in management. That is because you'll know that Brent has left the city and is now with the organ and tissue donation service out of Toronto, and his position of Director of Community Health Planning and Integration was in existence to help us get through the Pan Am Games cycle and to get through some of those early days with integration, which he was great at doing and leading us on. And we're very pleased that he found a good position in Toronto that he'll excel at, I'm sure. The other change that you see here is that you don't actually see up here, but has happened on the management level, is we took one of our managers within mental health and street outreach, and we combined the roles of mental health and street outreach with the alcohol, drug, and gambling services manager, and created a new clinical coordinator to better lead the care, the patient care side of it without actually being in a management position. One of the other things just to note, which is not on the slide, but which I track every year, is what our head count is as opposed to our FTEs. So this is our FTEs are at 402. Our head count is actually at 504. So we have a lot of part-time staff within the organization. We've actually been doing some work to see if we can bring that down. Despite those efforts, just by the nature of funding and the work that we do, we're still at a number, about 124 part-time positions. So our headcount remains very high. In fact, it's actually gone up over the last few years. So this is complement by funding source. So these are, one of the things that we're asked regularly is, how much is cost shared and how much is 100% funded? So you'll see here the majority of our positions are actually cost shared provincially. About 70% of them are 280 positions. The next biggest chunk is 100% funded by the province, about 109 positions there. A few are funded solely off the levy, And only one FTE now through the RCF program is funded through user fees. In terms of permanent vacancies, so this is one of the pieces that goes up on the S drive that you'll have. This was just a snapshot picture of where things stood on December 31st. So at that point, we had 7.85 total vacancies, and that sits at about it's less than 2% of our total staff population, as you can see from here. One of the things just to note within these, we're going to be talking about an opportunities slide later on in the presentation, and there are 2 positions within this that we are holding because they're ones that we're recommending that you consider from a reduction standpoint. Gross expenditures, so this is cutting up a pie about something a little bit different. This is the total $50 million budget that public health oversees. And you'll see that, as per usual, about 80% of our costs are employee related because the service that we provide is service that people provides. And so there's other operating costs associated with that, but it is people providing service that is the nature of our department. On this slide, you've got our revenue sources. So again, just looking at different pies that break down our budget in different ways. You can see here about, we have of our $50.6 million in gross expenditures, almost 73% of that is subsidized through grants and subsidies in the amount of $36.8 million. Just looking at that in a slightly different way, when we look at our gross net budget by funding source, again, the biggest part of our budget is for those public health mandatory programs, and you'll see that there's about $14 million as well in 100% funded programs. This is our budget by division, essentially, and you can see for this past year, this is a 5.8%. I can see Councillor Ferguson. Yes, we are at a 5.8% increase. So we're coming through to talk about some of the pressures related to this. As we look at it overall, we have a fair amount of variability across those, particularly with clinical and preventive services. So this is an area where there's been a large change related to our dental services. This is where the health services sorry, the HSO, Healthy Smiles, changes are going on with the Healthy Smiles integration and the changes to our sign-up program. So that explains the majority of the variation there, and some other smaller pressures within the divisions themselves. The other divisions within mandatory public health subsidy. So you'll see this is where another significant change and where our biggest pressure is coming from. This is related to the former year's subsidy was not realized, and of course we're budgeting this year in a different way. So what we've assumed last year, we assumed a 2% subsidy increase and didn't receive it, and so it caused a $497,000 pressure on our, or $69,000 pressure on our budget. This year, we're not budgeting any subsidy increase, and so that is, of course, letting all of the pressures fall to the levy. So we've taken the opposite approach based on what we know now, but you can see then the pressures are coming through. So let's move over to that pressures slide. Our employee-related increases are about $645,000 in pressures. Now, $123,000 is additionally, they are employee related, but it's due to the annualization of the one-time costs related to the air quality increase that was approved last year, as well as the pest control increase. So that's due to new programming over and above the existing. $469,000 is that funding pressure from last year's lack of subsidy, which is now out. And then, as I said, we've got the 0% subsidy put in this year. Low-income dental integration is saving us, the way we've budgeted it right now, about $273,000. That's a bit of a risk because we're budgeting based on what we know now. We don't have approvals from the province in terms of exactly what they're going to fund. We are working with them step by step to understand and get this put to bed by end of March, I think is their target date. But this is our best information that we know right now. We'll see as it goes forward. The next one is indirect cost allocations. So there's a $93,000 reduction here, and that's the largest chunk of this is really due to a change in our IT inventory accounting system. And so there's been a significant change here, which has benefited our budget. Insurance risk management has also been good with our risk experience. We've got a $77,000 reduction related to that. Our user fees, you'll recall that we had a 2% across the board, but added costs for special events where we were looking to fully cost recover on those. And so those have had significant increase in revenue of $45,000. And our vector-borne disease larviciding contract, based on our past experience, we're coming in with a reduction related to that. There's a bit of a risk because this is a contract that is tendered every year. And so, we're telling you based on our previous experience, and we hope that continues to be the case. Did you want to ask questions now as we go through?
Committee members that indicated they wanted to ask questions, shall we wait till the end? I had Councillor Ferguson and Councillor Partridge. Did you want to wait till the end? I think we'll wait till the end. Dr. Elizabeth, thank you.
So this is that slide I was talking about that we would bring forward to you in terms of budget reduction opportunities. What might be some areas where we can look at to reduce, and we'll bring back further details along with the rest of the corporation on February 12th with deliberations or wherever in the deliberations that comes forward. But right now we're thinking that'll be February 12th. We're looking at the vector-borne disease program. We're looking at changing our mosquito trapping and then the techs that we need in order to do that. So changing our surveillance protocol. We've had a lot of experience with this disease. We kind of understand how it works. We don't think we need to continue to collect the level of data we've been collecting. And so that's one of them. Another piece is the medical director / AMOH. So over the past year, what we did, we looked at how we could combine the medical director position that we had with the associate medical officer of health role and look at a different way of doing business related to that. So we piloted it the past year and found we were able to make some changes in the way we did business, the way we do things within that program, so that we could reduce the AMOH / medical director by about 1/4 of an FTE. Again, a bit of some risk, because if it turns out we've got some pressures from a patient management standpoint, then we're going to have to look at that, but that's what we're recommending at this point. YouthNet Youth Advisor is another. The program has been undergoing change as we've been changing our focus on what we're working on, and it's recommended here that that's one of those things that we look at. With the Healthy Smiles Ontario integration, as we finish this off in terms of understanding what they want in what budget where, we think there may be some additional savings that come from that. We're not sure the order of magnitude around that. It's not going to be anything like the $273,000 we've already seen, but there may be some additional savings related to that. And you might recall that I mentioned this as a pressure back when we got the initial funding announcement back in October, was we didn't know what was happening with dental. And in fact, it's turned out to be a fairly positive piece as we move forward. The last piece is around the Seniors Oral Health Clinic, and we have the oral health promotion program that we have going on in the long-term care facilities, which we talked about last time at Board of Health, and we're trying to understand the treatment needs in the community and whether there's sufficient resources between the program already run out of community emergency services and with people's private insurance and other means of accessing care, as to whether we need the full amount that had been reallocated last year for additional treatment costs. So we'll bring back some more information on that particular initiative as well. All right, so we're up to budget by division, so I think we'll keep going. Let Michelle go through these, and then we'll come back for questions. Sure, thanks. That's fine.
Okay, so we're going to start with the medical officer of health section. And this section is actually where we have our departmental costs, including our finance and administration, departmental cost allocations, our rental costs, our chief nursing officer, as well as the MOH related expenses. So we don't have an org chart for that area. We're going to go in.
Excuse me, could you just move that water jug? We can't see you.
Oh, sorry. Okay, the next area we're going to look at is clinical and preventative services division. The 2016 complement for CPS stayed the same from 2015. However, you're going to see that there's a reduction of 1 FTE in the manager complement. There's also an increase of 1 FTE in other, and that's what Dr. Richardson spoke to earlier, where we took an existing manager position and changed it to become that clinical coordinator. Overall, it's neutral with respect to FTE. This slide gives an overview of the budget by section for clinical and preventative services. The dental service section reflects the ministry integration that we already spoke about. The sexual health and harm reduction decreases that you're seeing here reflects decreases in high-fi fees as well as an increase in revenue for birth control, clinic recovery revenues. The decreases that you're seeing in BPD as well as the administration costs are related to decreases in vacation pay. Overall, the increases in this area are employee-related expenses. So we move into family health. Family Health Division, the FTE has actually decreased by 1.6 FTE from the 2015 budget. This is as a result of a 0.1 reduction in a position that was made redundant, as well as a number of secondments that ended in 2015. The largest increase in our Healthy Babies, Healthy Children section in the Family Health Division is really as a result of employee-related increases that are occurring within the 100% budget, and they're hitting the levy due to the zero increase within the Healthy Baby, Healthy Children budget area. Family Health, some of those increases are being mitigated through reductions where possible, but you're still seeing an increase in Healthy Babies, Healthy Children. Health protection. Health protection is not seeing any change in complement for 2016 from the 2015 budget. So FTE, we are neutral in the health protection area. When we look at health protection by section, the major cost drivers within this section, again, are employee-related increases. The residential care facilities, the insurance decrease is seeing some reduction there, as well as savings in the VBD program that we spoke about previously. The annualization of the 2015 enhancements are showing here, and they're driving some of the increases within the environmental health area. We'll go into Healthy Living Division, and you're going to see for Healthy Living that we actually had a 0.3 decrease in FTE. However, there is no levy savings here. This is as a result of positions that were 100% funded through a secondment, funded through the Healthy Kids Community Challenge as well as a secondment, so there's a net zero change here. Again, for Healthy Living, the majority of our cost drivers really are employee-related costs. We do have some savings in this area as a result of the move from 1447 Upper Ottawa to the downtown location. So you're going to see some savings there, but overall the cost drivers are employee-related expenses. And then finally, we have Planning and Business Improvement Division. Again, the FTE is neutral from last year to this year in this area. And you're going to look at budget by section for this area. Again, the cost drivers in this area are employee-related costs. There are cost drivers within the operating budget, within the administration budget. These are actually related to some changes that we're realizing through the administrative consolidation that occurred in 2015. There's no change in FTE. with what we have.
Thank you very much. I'll go to speakers list. Councillor Ferguson and then Councillor Partridge.
Well, thank you, Madam Chairman, and through you to Elizabeth. Clearly, 5.6 is problematic, and it's way above our target, and we're going to have to get our head around this to see how we're going to adjust it. And I'm not knowledgeable enough, or I don't have the expertise to find out where it needs to be trimmed. And I kept hearing from you that you're probably going to be coming back to us with some suggestions. Well, if you could go to slide 24. Typically, the province, in the 9 years I've been here, 9 budgets I've gone through, funds 75%. And now we see it slipping back to 72.7%. How come? And were we cutting back the programs that they're not funding anymore? This is starting to get away from us, and it could be a slippery slope if it continues. Comments?
Yeah, thank you, Councillor, for that. Through you, Madam Deputy Mayor. So this is where we have to look at a couple of slides to truly understand it, because there's a couple of things. One is that, so this when we think about 75-25, yes, on average, the whole department has been, by policy, one particular subset of our programs, the mandatory programs, are supposed to be 75-25 funded, and a few of these other smaller ones, small drinking water systems, vector-borne diseases, they're meant to be 75-25 as well. So when you look at it as a whole, in some ways it just happens to come out about the same level, but there's a couple of things to think about. One is that with the decision around the province, and this is sort of two separate things going on. So by policy, it's meant to be 75-25, but they decided this past year, as we talked about back in October, to change the way they were allocating their share of the dollars, and for them to only look at any increases to go to health units that they felt were relatively underfunded through a funding formula that was needs-based. And it was meant to redistribute or to distribute new funds to ones that were having these kinds of pressures where they're not 75-25. And it was in response to a lot of the comments and concerns coming from municipal councils about the fact that they were picking up more of the cost of public health services as they go forward. Hamilton sits right on that tipping point around whether, from a needs-based standpoint, we were relatively overfunded one way, relatively underfunded, the next year, depending on where we're at. And so in terms of them thinking that they needed to provide more of their share relative to the needs of the other organizations, they felt last year they did not. And so they did not provide us with any increases that would account for the kinds of increases that you just see year over year. So that's the $469,000 pressure that we talked about in the fall and that you see back up here in the slides. And then for this year, we have another 0%. We're assuming 0%. So they're saying no growth. And that's happening not just within the public health mandatory programs, but across the majority of our 100% funded programs as well. They're saying no growth, no growth, no growth. You have to keep it at 0%. But the costs of those programs and services, as we all know, we all go shopping, we all do things, we know that the cost of providing things goes up. And so they're leaving it to the organization to decide how best to deal with that. Part of the approach they're taking with the OPHS review is to say, maybe there's a change in the way we do some things that we need to think about. But they also talk in Patients First about the need to continue to invest and improve investments in public health. So I think they're in the midst of change, of thinking about what they're doing and how it's organized, but they're holding budgets right now as we go through it.
So when they say no growth, that's not even like your main driver was salaries and wages, $645,000. That means no growth for inflationary cost either?
That's right. They don't provide any increases for inflationary costs.
We should cut back our programs then, should we?
That's the decision of the board as to how they want to handle those sorts of things. So I think when we look at these things, you can see in some ways they've done some things that will lessen that pressure for us. And that's why I was saying around the health services, the Healthy Smiles integration, they have done some things that will help us address those. We've had savings that are offsetting, because that 469 for this year in everything other than dental would be another $460,000 this year in terms of a pressure. But they've offset that to some extent by the way they're shifting costs and they're picking up costs that were previously borne by the levy within the new Healthy Smiles program. So they're doing a bit to mitigate. Some of it too is about cost allocations and the way we do business in the city. So if you look, for example, back at programs, these 100% funded programs, so a lot of that $650,000 is decisions that council has made in the past to either shore up a program from a programmatic standpoint because we think it's important. So Healthy Babies, Healthy Children, for example, there's about $360,000, which council has chosen to continue to invest in that program because they think it's important to do more than the province funds us for. And we made a commitment several years ago that anytime there's a pressure within a 100% funded program, not to automatically assume you wanted us to cost contain, but to bring it back here and leave the decision up to council as to what you would like to do with that. On the cost allocation side, there's another pressure on top for many of those 100% funded programs. They're about the way we do business. And so those costs, when you're looking at these things that should be 100% funded, that's where the rest of that $300,000 is coming from.
Okay, that's very complicated.
I know it is.
And it's hard to grasp what you're saying, you know. And by the way, Madam Chair, we need to get that projector fixed. It's not sharp. The bulb's obviously going on this thing, and maybe clerks could, I know you got the dome pretty much close. I wonder if you could have the facilities group change the bulb of that projector. Sorry? They're sharp, sure they are, but the bulb is clearly going on that thing, and that's why it's starting to fade. Unless it's my age. Okay, so clearly, in my view, Madam Chair, 5.8% won't fly. And I don't know, I heard you say, and just go to slide 26.
26.
There's the 5.8%. But when you go down the individual categories, there's nothing there that's over 3.5%. So how do you get the grand total to come out to 5.8%?
It's that tricky math stuff.
That new math, is it?
I don't mean to be flip through you, Madam Deputy Mayor, but it's, you know, some of those things when you go through and look at them, I mean, the big pressure that's coming is coming from that mandatory public health subsidy, that $844,000 pressure from subsidy.
$597,000 drop up in clinical and preventive services.
Right, and so the things that are in that 2% line are, you know, within the divisions, they're all coming in at 2.4% or less. Like some of them are down at 1.3%, 0.9%. But because of that funding subsidy not being there to fund an additional 2% last year or this year, then that's the total bottom line. If there wasn't any mitigation of those things, you would see an even higher pressure within each of the divisions.
I'm still having trouble grasping, and I don't know, Mike, whether you can explain it maybe too, in addition to Elizabeth, but when the highest category of anything you see up there is 3.5% or 2.4%, how does the grand total go to 5.8%? Can you help me with that?
Yeah, just so through you, Madam Deputy Mayor, in terms of that table, if you looked at that bottom line, sorry, the second to bottom, the mandatory, if you just notice in terms of the weighting, that's $23 million in terms of the weighting.
But it's only 3.5% impact.
Right, but you're taking a 3.5% of a greater piece of the pie, a higher weighting. And so when you're losing that 3.5% on a more significant portion of the budget, it affects the overall weighting of the budget. So that's how you get 5.8, is because that 3.5 represents 3.5% change on 23, just short of 24 million, where all of the other changes in terms of the, let me just flip to my page because it's clear. So
Mike, I don't want to dominate this thing. The big problem then is that the province has cut back our funding by $844,000. Is that really the bottom line? That's why the Board of Health is up at 5%?
Yeah. So through you, Madam Deputy Mayor, as Dr. Richardson's included in her slide deck, I think I'm on slide 27, that public health formula, the pressure of the 469, you'll see third from the top, that's a significant driver in terms of that 5.8% pressure going into 2016. So the fact that, as it relates to Hamilton Public Health Services, that we aren't realizing the change in the subsidy in terms of the mandated programs, because we aren't getting that indexing, that's contributing to that $469,000.
So because they
pressure.
keep it exactly the same when it was 75%, they don't index with inflation, and this starts to slide away from us then.
Absolutely. So in terms of slide 25, in terms of slide 25, if you look at that top line, some of us are familiar with public health being 75% provincially funded and 25% locally funded. You'll see in that top line, in the case of Hamilton Public Health Services, we are 28.5% locally funded. And that means we're deviating from that, well, some of us are commonly familiar with that 75-25 ratio.
Okay, so I heard Elizabeth say during her presentation, that, and correct me if I'm wrong, that you can find ways, you'll come back to us with suggestions of how we can reduce that 5.8%. Did I hear that correctly, first of all?
Through you, Madam Deputy Mayor, if I could go back just for 1 minute to this slide as well. Yes, the biggest pressure in terms of not meeting our inflationary costs is the lack of subsidy. But I do want to point out that the annualization of the 2015 enhancements is also a significant piece and was never meant to have subsidy. And so that's...
Was consolidating everybody at one location, is that the big enhancement? Consolidating everybody at the new health building and at the Standard Life building?
Do you, Madam Deputy Chair? No, those, and in fact, we already found in the past, in 2015 for that budget, well, it happened over 2013, 14, 15, we found $475,000 worth of savings to offset the cost of consolidation. And so the costs of consolidation haven't come in wildly different than what we said. These are actually the new bits of programming that were approved last year in air quality and pest control that are now being annualized this year. So these don't have anything to do with the consolidation whatsoever. They're programmatic expenses that were approved by council last year and are just now coming to fruition fully in 2016. So I'll go back. Remind the council, you were saying in terms of mitigation. So this, in terms of proposed reduction opportunities, yes, this is where we're bringing forward to you, and just wanted to highlight for you today because we understand 5.8% is a significant piece, that we understand those challenges around, okay, what do you do when you've got the situation where the Board of Health is responsible for determining the appropriate amount of resources, you've got a policy decision by government, and they're in the midst of change themselves, that, these are some opportunities you may want to consider in terms of mitigating those pressures, and particularly around the vector-borne disease control program, the medical director position, the youth net. As I said, we're not sure whether there'll be more beneficial effect from the HSO integration on some scale, which is not about us cutting service. And that's where I did want to flag as well, there, in terms of service levels, there are some service level impacts from the first ones, but not necessarily from Healthy Smiles Ontario and then Seniors Oral Health Clinic.
You'll come back with us in the future and quantify that. Right. Okay, my last question, because I don't want to dominate the questions here, about is Elizabeth, you sort of just slipped it in as you're going on your presentation that user fees have gone up by 2%, which I agree. Certainly we saw that in planning too for building permits and so on. But yesterday I was confronted by a member of the Rotary Club of Ancaster, and this will affect everyone. That's why I'm asking this question publicly, because everybody has festivals in their respective boards. And he showed me an email he got from Public Health where you in the past have charged $35 per vendor for health inspection. And this is for the autumn stroll, where they have about 25 food vendors, and you're taking that up from $35 to $135, or a 4 times increase. And that bothers me, that we're always kicking the volunteers. We saw it with police when with their paid duty going up exponentially, and now here's the health department. And this is, I saw on your slide, user fees are only 1% of your total budget, but you're whacking the volunteers who run festivals around our community with an increase of 4 times. And I have, when the individual put this in front of me, he says, health says, council asked for this. Geez, I don't even remember it. And I remember the 2%, but I don't remember that you're going to whack the volunteers by an increase of 400%. So why are you doing that, first of all? Or is it true? First question. Secondly, why are you doing that? And how can we fix that? Because everybody's going to start hearing from their various festivals about this thing that's happening.
Through you, Madam Deputy Mayor, I'll start off and then I'll turn to Rob to answer. But just to take us back to the service, the programmatic pieces. So we had talked in the 2015 budget process about some of the pressures we were having in terms of keeping up with inspections and some of the things that were preventing us from reaching some of the targets that we had. If you look at this target at the top, I don't know why I can't get the red thing to work. Oh, there it goes. If you look at this target at the top, you'll see that it's 98.5% for high-risk food premises. The province really wanted us, if you remember going back in our negotiations, they really wanted it to be 100%. And we said, you know what, we don't think that it's practically feasible for a couple of things, but because of Pan Am in particular, we don't think that it's feasible for us to do in 2016. So we don't want to say we're going to do something we can't do. Like, we honestly didn't think we could make it. And even with that agreement, and with the changes that were made within that division to provide the services in new and different ways, change our staffing models, do those things, we came in at 97.4%, which is pretty good. But one of the other pressures we talked about was about special events and the fact that how special events fall under the mandatory programs, and Rob can speak to this in far more detail than I, that it was causing a significant pressure for us in terms of ability to carry out the mandatory programs. And so we brought forward during the 2015 budget presentations an enhancement in order to do that work and get it done. And we were told at that time to look at a different strategy through which to address that, and that's what came forward through the user fees report that was done earlier this year. So I'll turn it over to Rob.
Through you, Madam Deputy Chair. Elizabeth said everything I was going to say. In 2015, we brought forward a report indicating that the province doesn't consider special events fixed premises under the food premises guidelines. And so when we do our reporting on inspections of those, because these are transient and they're sort of these types of facilities that pop up at festivals, they're not counted as far as our statistics in these indicator to the province. We brought forward a report for enhancement last year as part of the 2015 process to say that we would like $55,000 enhancement to offset the costs of doing these inspections after hours and on weekends, because these are really overtime costs that we have to incur in order to still provide our mandatory levels. At that time, Council suggested that we look at increasing user fees to fully cost recover this. So back in the user fee report that was done, I believe, in December, it was highlighted in that report that there would be about a 230% increase in these user fees to offset the costs of doing these non-mandatory type inspections that the province doesn't consider mandatory under their reporting structure. We figured that would be a bit of a problem, but at that time we were prepared to try and answer the questions that would come up. We knew that this type of an increase would be an issue with some organizations, but we were just following the mandate of Council to find an alternative funding source for this.
Okay, it's not up 200%; it's up 400%. If it goes from $35 to $135, which is the email that was handed to me yesterday, and secondly, it's not mandatory. Why do we do it?
Through you, Madam Deputy Chair. We know that these premises are preparing food. Food preparation and the sale of it is a public health hazard. We have to do inspections at these places to ensure the safety of the public consuming this food. The levels and the types of inspections we can do, we're constantly trying to upgrade. But the food premise regulations doesn't apply to them. So we have to provide guidelines and then do inspections to ensure that they have proper hand washing, proper hot and cold temperatures, those types of facilities, in order to make sure that when they're handling this food in a transient type of situation, that they're not preparing it and presenting a public health risk to the public.
Okay, but Rob, I've volunteered at the Autumn Stroll, as I'm sure Councillor Johnson has at the Peach Festival, or Councillor Vanderbeek at the Cactus Festival, and quite frankly, what I see is we have to wait at the Autumn Stroll until everybody's set up. Every one of the vendors are there. And then the Board of Health arrives, and there's 2 inspectors, and they're generally done in an hour. and I'm not aware of anything that found this inappropriate. And in the case of the Autumn Stroll, and I suspect of a lot of our festivals, these are restaurants that are volunteering to come in to let the public see the thing. It's a fundraiser for the Rotary Club, and they do quite well with it. Where this is a $2,000 hit to them, and I don't understand how it costs $2,000 extra. Well, but you're getting before to send these 2 health inspectors in for an hour. Maybe you have to pay them 4 hours under a collective agreement, but still, this seems to be far more than cost recovery. But this is going to become a political issue because when you pick on volunteers, you're going to get pushback. And it's already starting. I see Jason nodding that he's been contacted by somebody. So is Councillor Van Der Beek and waiting for Councillor Johnson. And everybody gets festivals in their wards. And so I'm not sure that's the right thing to do, to whack volunteers. And, you know, if we don't have to do it, these are good quality restaurants that come there who understand the health requirements. They got hot water. It's provided by the club. They bring in a big heater and provide the hot water. And if they're not ready to go, we'll just barricade them off. And so the public doesn't get access to them. So I'm just having real trouble with this. And I would like to see, Madam Chairman, if you come back to me, I might put a motion on the floor. Report back to us that for special events, festivals, if we took that back to $35 per vendor or whatever the measurement is, what would that? How badly would that impact the budget? And that's the end of my questions, Madam Chair.
Back to you, Councillor. Thank you. Councillor Partridge.
Yes, thank you, Madam Chair, and thank you, Elizabeth, for the presentation. And my questions were on slide number 25 and slide number 24, and basically what Councillor Ferguson has asked. And I really appreciate the line of questions. And my only comment, and I'd be pleased, by the way, to second that motion of Councillor Ferguson if you want to bring it forward. But I've been hearing from the groups in my area. It's just too big a hit for them, and especially I look at the Chili Fest, and again, these are all good restaurants that have to pass all their inspections to be in operation in the first place. We have the event inside the Legion. Everything is there, and I just think the 135 is just a way too high of a hit, and especially if it's each vendor. And we do maybe 12, 14 vendors. But again, I think we have to rethink how we're doing some of these things. And I understand that we approved it through the board when it came forward in the fall. But I don't think many of us realized just how big a hit it was going to be. And these are the very organizations that, you know, they're trying to raise money. The Flamborough Women's Resource Centre, they do the Chili Fest. That money, it's huge to them. So I just think we have to address it. But, you know, with the mandatory programs, and I guess I have one question through you, Madam Chair. If I thought I heard you say, and I understood the explanation to be, that the province is not allowing for any increases regardless across the board. How long is that going to go on, though? Because what I thought I heard is that they're re-looking at the funding model and the programs. How long is that going to go on? Do you have any idea?
Through you, Madam Deputy Mayor, that's a good question. And in terms of how long will it go on, we've been fortunate, I would say, within public health, from the mandatory program side as compared to some of the other 100% funded areas. They've been experiencing it for far longer than we have. And so it really came to fruition with them stepping back and looking at their funding model and trying to get a rational basis for funding and you know, meeting some of the pressures that were out there. And so, you know, I appreciate where they're coming from. They're trying to do things that make sense, right? And not just have stuff that happens based on historical. What they initially told us was that we couldn't count on increases going forward, but they've stepped back a little bit and said they're going to continue to be looking at and refining the model around it. So the long and short of that is I don't know. And it's not the easiest place to be from the standpoint of putting budgets together, because you have some direction but not clear direction. And in some ways I feel that we may miss out on opportunities if we make too many of those kinds of assumptions that there's not going to be anything there. It's the classic, you know, grant seekers challenge of, you know, if I don't ask, nobody will say yes to anything. There's nothing to say yes to. And so that's part of the challenge. The programmatic review piece, the OPHS program review, which is going to be looking at these things, is scheduled to happen in 2016, and they're indeed we see them making steps towards getting that done. It's a very aggressive timeline to review all of the standards, and so, I hope they're able to deliver on that, but it's a tough thing. We're certainly not going to know that for preparation of the 2017 budget, though, because we start that process in August, so we won't have it by the time we get there. The other piece about Patients First and what they've now put on the table. So you see, I'm onto my third thing that's going on, right? We're with Patients First and them talking about how funding and accountability will now flow through the LHINs, and this putting together another working group which is going to review the LHIN Public Health Partnership and how that should work and how to improve investments, improve public health capacity. That's a third iron in the fire, which is meant to, again, work over 2016 and have some results in a year's time, again, not in time for 2017 budget preparation. So there's all these irons kind of going on, but it's definitely going to take us through 2017 prep into 2017 approvals, and will it take us beyond that? Not sure.
Yeah, and I appreciate that answer, because obviously we're dependent so much on the funding coming from the province for whatever we can get, and as you say, you've got irons in the fire, and if you don't ask, you won't get. But it's a worrying trend. It's a very worrying trend, and especially when I'm now hearing that it's not going to be in time to be considered or included, I should say, in the 2017 budget process and approvals as we go forward, that we're looking at even farther afield than that. And I guess my last question, Madam Chair, through you, and Elizabeth, I hope this comes out in a good way, but let me just spit it out and we'll sort through the words after. So how often do we look at doing our work of public health differently? Is that something that is only driven by policies that come out of the province or funding? Is that an ongoing thing? Because I did hear you make the comment in your presentation that it may mean we have to look at delivering our service and doing our business differently. Those weren't your exact words, but I'm paraphrasing.
Through you, Madam Deputy Mayor, it came out just fine. In terms of how do we improve our services, when you look back at a number of the things that we've been doing, you'll see we're always looking at how we can improve our services. We had a great presentation from Anil Gupta, who's a professor at McMaster University, talking about lean and about how we can, look at continuous improvement. And lean's one set of methodology around how do you continuously improve. We have a long history within public health of a deep-rooted piece about evaluation, evidence-based practice. So we're always looking at how do you continue to evolve and change things. But Anil also talked about the fact that you can't do that to everything. It's like boiling the ocean, right? If you're trying to look at everything and how do you do it differently, you just get really caught up. And so we do have the standards that we're supposed to follow, and we do. But we're always looking at what's the leading edge of practice, and the government is also looking at changing the other component documents under them to bring them up to speed as well. And so we do that in tandem with them. We're trying not to duplicate, to learn together. And with Public Health Ontario, the overarching agency in the province that looks at best practice in public health, they're also doing that work with us, as a whole in the province. And so we learn from them and get changes and whatnot from them as we go. So it's a continuous process trying to decide what's the most critical thing to look at and change, because practice has totally been revolutionized, or because it's not working here, or we have another better idea. We're constantly doing that, but trying to say how many of those things can we do in any given year. It's been a busy couple of years for us in terms of doing those things.
Right, and especially with Pan Am put on your plate as well. Thank you. Those are my comments and questions.
Thank you, Councillor. I had Councillor Vanderbeek and then Councillor Green.
Thank you, Madam Chair. Through you to Elizabeth. Just back to the conversation that took place with Councillor Ferguson, I wanted to point something out. For instance, I'm going to use the Dundas BIA and Buskerfest as an example. So the Buskerfest envelops several merchants who come out onto the street and then some vendors that they bring in. And so they received the letter yesterday with this rather large increase for them. And Buskerfest, the BIA for Buskerfest pays for the public health inspections for their vendors and their merchants. So they come forward with to the City Enrichment Fund for a grant, as most of the festivals do, and that grant application has to be in the fall. So they worked their budget out based on $35. Now they've learned that it's going to be 400% more, and so they aren't in a position to adjust their budget for their funding, and that makes it problematic, and I am positive that they are not alone. So I think that on top of the fact that there's a huge increase is sort of the insult to injury that they have no way of recouping that, and they certainly can't, when they've historically paid it, go back to merchants and vendors and tell them it's their responsibility. So I just want to reiterate that I'm fully supportive of what Councillor Ferguson was talking about and saying he's going to put forward a motion. And I'm happy at the appropriate time to second that motion, that it go back and be examined, and we really need to deal with it. There's more to it than just what's seen as cost recovery for public health services when it does involve so many volunteer workers and our BIAs and people who are really trying to do things to improve the city and make, bring the community together and do all the things we want them to do. We need to be supportive of that. So I really don't have a question. It really was just a comment. But I think it's important to understand that it is much further reaching than just, let's increase the fee and be cost recovery oriented in the department. Thank you.
Thank you very much, Madam Deputy Mayor, and I certainly have a great appreciation for conversations around these events. I know at the BIA subcommittees this has come up numerous times, and we're looking at ways we can work with staff, because what became apparent in this, as well as many overlapping budget presentations, is it's what I would call circular funding between departments. So we have costs that we're putting on for particular events, whether it's the police paid duty or these types of health inspections that end up coming back to enrichment, where we end up funding fully. So we're actually funding our own fees through other departments, which is interesting. It was an interesting kind of realization for me last year during this time. Having said all of that, I also fully recognize the CNE Cronut disaster of 2013, when like 200 or 300 people became sick with foodborne illness. So I fully appreciate and recognize the importance of having those types of frequent increased checks on food supplies. So I'll just put that out there right now. We don't want to have a Cronut disaster waiting in the wings for one of our events. But if you could for a moment go back to the place where you thought, Madam Deputy Mayor, through you, where you thought there might be potential efficiencies. So you've done a great job kind of identifying the vector-borne disease and the medical directors and ways that we might be able to find efficiencies there. But what's still very real for me particularly are on the dental programs. So if you could just maybe elaborate a little bit on that, on the integration of the Healthy Smiles or on the seniors oral health clinics and what role that plays, because at the end of the day when this is done, if we support these recommendations and these are removed, I don't want to be responsible for taking away potential dental supports to vulnerable seniors. So I just want to make sure that that's clearly outlined in terms of what's offered in those services, if you could.
Through you, Madam Deputy Mayor. So just again to be clear, this you're not approving these today by any means. You're going to see more information come forward on February 12th, and they'll be then in the organization's context as they're looking at the budget as a whole. There'll be other ones that come forward from other departments. It's just, as I said earlier, recognizing the degree of the pressure and the fact that a lot of it's related to the mandatory programs. We have been exploring actively what we think we can do. as a management team. So on those two dental ones, I'll start first with the Healthy Smiles Ontario integration. The HSO integration, as I said, initially we thought there was going to be some budget pressure related to it because they were taking what had been a cost-shared program, 75-25, and moving it over to be 100% funded by HSO. And when we got that funding letter last year in October, they were talking about how, we'd made some assumptions too about, okay, great, well, when you move that over, that subsidy can be used to meet those other costs. They'd said no, that the subsidy was going to get moved. And so we were like, oh dear. Then we've got another hit related to that particular part of the programming. But indeed, as we've gone through and understood where they're coming from, they're not doing that from last year's. The last year's budget is whole in that it's not a greater hit from the assumptions we'd already made based on the information they gave us. And indeed, when they've been moving the pieces of the program over, they've been keeping the 25 cents of every dollar. So say it cost $1 over here. We thought they would move 75 cents over to the new program. In fact, they've said, no, they're picking up the program at $1. And so that's, or at least based on their draft, we'll see, as I said, the final approvals. So that's good news. So now they hadn't fully transitioned the program, though. So we had that one set of assumptions for last year. As they finish that transition, there'll be some more subsidy room that's opened up. But we are assuming this year that will move with it to the new program, whereas last year it didn't really seem to do that. So we're not assuming that comes in, but we are saying for the 25 cents on the dollar that council was spending on that program, you won't have those expenditures anymore. So we're just trying to figure out how big that is. And it's, as I said, it's not going to be anywhere near the scale that it was in the previous year at 273,000, but there may be still some benefit this year as we finish off that transition. Now, the monies, the 25 cents on the dollar based on what we knew last year was already allocated to seniors' health. And so that's how these things are intricately linked, because the savings that we could have from the HSO integration have already been applied to the seniors' oral health program. And because this kind of came out of things that had been discussed with the integration, but we had no idea what they were going to do. When that opportunity came to us, and we said, looking back at the previous oral health reports, seniors' health was a thing this council consistently raised as a concern in the community. And so we said, let's take those funds that you were using for oral health and continue to use them for oral health, but now oriented to seniors, because kids are now being taken care of a different way. That's where the greatest need was. So we said, we don't know yet exactly what we would recommend in terms of a program that you would do. And so we came back this year with, or just last time, with a paper about oral health promotion, which is really looking at how can we improve the oral health provided within long-term care facilities, because that was where we heard from the community a significant amount of need. So those dollars have been invested there, and then we're looking at the rest and whether there's a need for actual treatment to be funded out of those. And so because we've not provided that program in the past, we're trying to, based on statistics that we have, try and estimate whether we really think you need all of those funds now. And so there's still some work we need to do about that before we bring it back to you, and we'll bring that back to you in the upcoming budget deliberations.
That is fantastic, because it's been my experience recently, shifts in provincial funding leading to changes in how we fund things, and I can use examples through community emergency services. If we just left that slide out there for the media, for the people watching, and all they read were proposed reduction opportunities to XYZ, without the full understanding of the flow-through funding from the province and the offset that we're having in other ways, they would assume that as a council and a public health board, we were cutting those programs. And so I'm gonna make the request that for the future meeting, that when you bring this back, that is articulated somewhere, because I can tell you, sitting here for 5, 6, 7, 8 hours at a time, we listen intently, we try to hear everything, but at the end of the day, we'll often refer back to these notes, as will media, as will members of the public, and they're going to say, you cut seniors' oral health. And so it's very important we articulate where the province is picking up the tab and where the city budget is seeing a reduction or potential efficiency, so that the public understands these programs are continuing to be funded, and that we're just finding efficiencies through the changing of formulas and not through callous decisions to cut, seniors' oral health. So those are my comments. I really appreciate that explanation. It certainly helps me out a lot, as I'm sure it'll help out members of the public.
Thank you, Councillor. And seeing no further speakers, I know Councillor Ferguson had a motion, but we'll wait. I do want to ask a question myself, and nothing's been mentioned today, but whoever, Dr. Richardson, I'm reading or hearing about this Zika mosquito and virus. And it says, I heard last night on a program that the mosquito actually has survived up to New York. So I'm assuming we're going to have similar issues within the next year or so. And what are we doing to prepare ourselves?
Thank you, Councillor Pearson, not in the chair at the moment, but I'll toss that one over to Jessica again as our communicable disease expert amongst the associate medical officers. She was kind of hoping, I think, for a question on Zika virus today, so we fulfilled her hopes.
So thanks very much for the question through the chair. So Zika virus has been in the news a lot recently. This is a mosquito-borne viral illness that generally causes more of a mild disease. However, the recent interest has been around an association found in Brazil that Zika virus may in pregnant women cause malformations or birth defects in the child. And so, of course, that's very concerning. In terms of the risk here in Hamilton, it is currently very low. We currently do not have the mosquitoes that support transmission or spread of Zika virus here. And I'm not an entomologist, but right now there are certainly no predictions for those mosquitoes to come here in the near future. Those people most at risk are those people who are traveling. And this is one of many mosquito-borne illnesses that you can get when you travel. So regardless of where you're going, you always want to protect yourself from mosquitoes. The same thing here in Hamilton, we talk about in the summer months, West Nile virus. That's another mosquito-borne illness that you can protect yourself against. So if you're traveling or you're here in Hamilton, the best things you can do is stay away from mosquitoes. Cover yourself up, long sleeves, long shirt, wear insect repellent if you can. And with Zika virus in particular, it's important to remember that the mosquitoes that transmit this virus are day biters, meaning they're not just the ones that come out at night, so you do need to protect yourself all the time.
Excellent, thank you. That's more information than I've received on the programs. Thank you very, very much for that, and I think it's great for the viewing public to also get an update. Thank you. I'll take the chair back. Thank you, Mr. Mayor. And with that, Councillor Ferguson hasn't returned. Councillor Johnson, did you want to, or actually I'll go to Councillor Vanderbeek maybe, who wishes to take it. Move by yourself? Sure. Second by Councillor Vanderbeek.
That the public health, wait a minute, he's got the writing of a serial killer, so give me a minute. That public health services report back and the budget impact and reduced charge for health inspection at festival and events be reduced to traditional levels. Something will be member of festival and events annually and number of vendors at each event. Included will be number of festival and events annually and number of vendors at each event.
Okay, does everybody count? Are we comfortable with that? Stephanie has not got it. Would you rather wait till Councillor Ferguson returns?
No, I think I have Madam Deputy Mayor, I think I have the gist of it, so I will wordsmith it a little bit and confirm his intent, but I believe I've got the gist.
And it'll be for us in the minutes as well.
Absolutely.
So thank you.
Yes.
Thank you. And it's been seconded by Councillor Vanderbeek. Mr. Mayor.
So understanding there's going to be reporting back, I don't want to end up in a situation where we then make the change and then hear back that there are some issues coming out of health issues relative to festivals. So can we also report on any potential negative impacts as a result of making the reduction when it comes back? You have an answer to that already? Geez, that's quick.
Through you, based on what I heard as far as the draft motion, we'll still be providing the services. It's looking at the impact of reducing the budget impact of reducing the fees back to the 2015 level.
Right.
So invariably we'll be not generating that revenue, and we'll be upping our cost in terms of our budget here. Correct?
Through you, that's will probably be the impact of reducing the fees by still needing revenue or still needing money to offset fully cost recovery.
Just so we know in advance, do we have a number in terms of what that you know what we...
It'll be approximately $39,000 that we would need on a levy. Yep.
Okay, thank you.
Okay, on that then, may I have a motion to, all in favor of the motion, sorry? Carried, thank you. Councillor Ferguson, we dealt with your motion, sir. And then now may I have a motion to receive this presentation? Moved by Councillor Connolly, seconded by Councillor Farr. All in favor? Carried. Thank you, everyone. We're going to move on to 5.2, Planning and Economic Development Department, proposed 2016 operating budget. And I'm not sure. We're just going to wait for staff to do the changeover, and I think Mr. Jason Thorne will be presenting.
What's that?
Actually, that might be better.
Actually, that probably close to works. There you go.
There's got to be some kind of health and workplace safety.
And ergonomically correct mic. Hey, good.
Okay, if I can get everyone to settle down.
We've incorporated a box in the org chart to reflect the LRT office. So that's the box that Paul Johnson is sitting in as the Director of LRT Coordination. We are showing a net decrease of 1 FTE in the staff complement department-wide. That's the net result of a couple of things. We had 1 FTE added, and I'll speak to that when we get to the building division slides in a little bit. We had 1 FTE added for a zoning correlator. That's under the delegated authority to be able to hire staff on the enterprise model as long as there was no net levy impact. So there was 1 position added mid-year under that delegated authority. And a reduction of 2 FTEs, which is from the Residential Drainage Assistance Program and the Block Swales Program, which councillors may recall came to GIC, the last GIC. That's a pilot program that has wound up. It will be before you next week for the enhancement discussion, whether or not council wants to reinstitute that. But for now, we're showing that as a reduction of 2 FTEs, reflecting the wrap-up of that pilot program. Talk about some of the 2015 highlights from the perspective of PED. One of the signature achievements of the city in the past year is something that we've reported on in the past to council, that this is the 5th time in the last 6 years that we've exceeded $1 billion in building permit construction value. You'll note that the last term of council we averaged around $975 million per year. In the first year under this term we're at just over $1.1 billion. So continue to see encouraging numbers there. Notable in 2015, you'll note that the actual number of building permits took a significant spike. That's reflective of a couple of things. Primarily, what we're seeing in 2015 was a surge in some of the smaller scale projects, a surge in residential, and especially some of our small scale commercial developments. So in 2015, I think the good news there is we hit the $1 billion, and we hit it without having one major project. There was no big hospital, there was no big stadium, but we were still able to hit that $1 billion. Opportunities for growing the non-residential assessment base in the city. Again, this year we had a few notable successes in that regard. We had Fibercast, who shifted from a 7,000 square foot facility in Ancaster to just over 90,000 in the Red Hill Business Park. Stackpole, one of our auto parts manufacturers, had a 60,000 square foot expansion. They're now employing about 900 people. Ronsko is leasing now a 70,000 square foot building on Burlington Street. Janko Steel in Stony Creek had their fourth expansion of 10,000 square feet. They're now sitting at over 200,000 square feet at their facility in Stony Creek. We had the opening of the Arts and Sciences Brewery. That's another 50,000 square feet of non-residential. And of course, the cross-dock cargo facility up at the airport represents about another 70,000 square feet of non-residential assessment space. So some pretty good success stories on the non-residential side. Lots of success on the small business front as well. And as I said, looking at the building permit values, we saw a lot of the activity in 2015 was generated by small or mid-sized businesses. Many of these are supported by our Small Business Enterprise Center. They supported 191 new businesses in the past year, representing about 235 jobs. That includes the Starter Company program that works with youth just out of school, age 18 to 29, provides them with mentorship and advice and grants up to $5,000 to get businesses started. That program generated 36 new businesses and 59 new jobs. And then the Summer Company program, which had been a pilot program, Council in the 2015 budget provided some funds to make that now a permanent program within the SPEC. And they had another strong year as well, supporting the creation of 28 new businesses, representing 37 new jobs. This program works with students who are in school to start up summer programs, although notably in the looking over the past 5 years, just over 87% of the businesses supported through the summer student program are actually still in business 5 years later. And one of the signs of success of the SPEC, and you'll see this reflected in some of the later budget slides, is a fairly significant increase in provincial grants to those programs in 2016. Our business licensing team continues to maintain high activity levels. We had about 9,000 business licenses in 2015, reflecting about $2.7 million in revenues, and just over 2,000 licenses and permits coming through our one-stop. We have a number of activities in 2015 as well to make sure that we're sustaining and hopefully increasing that business growth in the city. Our very successful corporate calling program continued, reaching out to about 100 business owners, and that program has been effective at sort of catching businesses who may have been looking to find new space, additional space, who may have been looking outside the city. This is sort of a way of catching those businesses early and trying to find them opportunities to relocate within Hamilton, to expand within Hamilton. We also initiated an update to the economic development strategy. It's looking at it's going to be a very focused strategy that we bring forward to council in a couple of months to look at what some of the medium to long-term workforce needs are going to be in the city, and to make sure that we're preparing for that. We also know in the active strategy that arts and culture is going to be a major pillar of that economic development strategy. We're continuing to see that as one of the drivers of our economic growth. We've seen in 2015 we had a few successes in this regard. The Juno Awards, obviously, was a major success, $12 million in economic impact from that one event alone. And a very busy year in film production. Actually, the slide there says $7.5 million in direct spend. It was actually $8.5. This was a number from, I believe that was in October, but at year end we were at $8.5 million in direct spend from the film industry in 2015. And a number of other activities related to building that cultural pillar of our economic development strategy in 2015. Invested $4 million in some of our heritage resources, our museums. Facilitated about 400 special events through the SEAT office, and completed or awarded 4 different public art projects. Some of the indicators, some of the economic indicators from the past year, Mike Zagarek reported on this number in the GIC presentation a week or so ago, that we're looking at about a 1.3 assessment growth. That number may change once the final figures are in. I think another very encouraging stat, and one that we probably I don't think talk about enough in Hamilton, is that we continue to be the most economically diverse economy in the country, according to the Conference Board of Canada. And we actually had a small uptick in our economic diversification rate in 2015. Unemployment rate sitting at average of 5.2% over 2015. And our industrial vacancy rates actually is also sitting at a pretty healthy 2.6% for industrial building vacancies, which is a little below the provincial average. The provincial average vacancy is around 3.6%. Development activity in the city was fairly stable in 2015. We exceeded our projections in 2015 in terms of development applications. We had projected about 850 development applications. We actually ticked in at just over 1,000. And housing starts in 2015, fairly consistent with the average over the past 10 years. So we had just over 2,100 housing starts. The 10-year average is just under 2,100. As part of that, we registered 10 plans of subdivision. That's just over 1,000 units, and registered 14 draft plans of condo, which was just over 500 units. We're again continuing to see lots of interest in development in the downtown. Another pretty strong year for downtown development. In the past 2 years, we've now seen just over 900 new dwelling units pull building permits in the downtown. If you can compare that to the previous 2 years, 2012 and 2013, we were at 56 new units in building permits in the downtown. So quite a significant increase in terms of dwelling units over the past 2 years in the downtown core. Estimated job growth in the downtown, about 195 net new jobs. And our incentive programs continue to be quite popular. We had just over 100 applications through our Urban Renewal Office from our various incentive programs in 2015. In terms of the waterfront, we had a detailed update go to council back in November in terms of where both PED and PW are at with some of the various infrastructure and planning projects to support the council mandate of having the lands shovel-ready by 2018. Some of the milestones achieved in PED were a transition of the marina management agreement with the Port Authority. We launched a fairly extensive community engagement process across the West Harbour, that including opening up the West Harbour storefront and starting to host monthly meetings out of that storefront to keep the community updated as to what's happening in the West Harbour area. And we initiated in 2015 the background work with Deloitte for the real estate disposition strategy. So we shortly be coming forward to council with some recommendations coming out of that work. The Growth Management Division moved forward on a number of key development-related infrastructure projects. That includes MOE approvals for the Waterdown East-West Bypass in 2015, commenced construction of the Upper Red Hill Parkway, which we should be complete later this summer, and completed the first phase of the urbanization of Rymal Road from Dartnell to Fletcher. So talked about some of the immediate development approvals and applications we had in 2015. In parallel with that, we're continuing to look at some of the longer range planning for that next wave of growth in the city. In February, the OMB approved the AEGD urban boundary expansion, secondary plan, and zoning bylaws. Council adopted a new zoning bylaw for the rural area. And we had the first phase of the Bayfront strategy and initiated a number of secondary plans for Centennial, the tall buildings guidelines, the downtown secondary plan, and the Pier 7-8 urban design study. And then running in parallel to all this, we obviously had the provincial plan review, so that occupied a lot of the time of the long-range planning staff and planning division to be able to comment and provide the City of Hamilton's position on the review of the Greenbelt Plan and Growth Plan. Finally, 2015 saw a major emphasis on the council priority of making sure the city is open for business. As you know, in 2015, early in 2015, council reconstituted the Open for Business subcommittee to direct our Open for Business initiatives. We reported in May of 2015 on the work of a consultant that we had to do a qualitative review of our development approvals process. That review identified a few themes for us to focus on within Open for Business, looking at resourcing, looking at the approvals process, looking at technology, and staff training and development. So those four themes continue to be what we're focused on through the Open for Business work. With respect to resourcing, Council made a number of significant investments in Open for Business in 2015. That included the hiring of a director for the Open for Business initiative, the hiring of 2 additional facilitators in our business facilitation unit, one for the rural area, one for small businesses, additional staff in growth management, and a levy enhancement that enables us to fill some additional vacancies in the planning division. So that resourcing has resulted in some increasing resourcing level, or that investment has resulted in some increasing resourcing levels in those divisions. With respect to process improvements, which was the second major theme that the consultant had identified for us to work on through Open for Business, we've constituted a what we call our continuous improvement team within PED and PW, some of the senior staff and directors from those two departments. And we've been doing what the consultant had recommended. We're going through case studies that have gone through the approvals process and to look at those case studies, what were some of the things we did right? Are there areas we can improve? Are there lessons learned from some of those applications that can result in process improvements going forward? I will be coming back to GIC in May with a report on what we've worked on since that since the consultant's report was presented back in May of 2015. There have been a number of process improvements that have been put in place through the work of that continuous improvement team. Sorry? And generally what we're looking at through the process improvements are what are some steps that we can just remove from the process altogether. Those steps that are necessary to the process are the ways we can do them more efficiently. What can we do to improve the quality of applications submissions we have coming in? So looking at are our guidelines and requirements clear? Looking at technology, so in 2015, we put significant energy into bringing the Amanda platform on stream. It's been used by building and licensing in the past. We now have planning with their site plan approvals and formal consultations are now on the Amanda platform. And in growth management, the water, sewer, and excavation permits are now on the Amanda platform. And through 2016, as I'll speak about in a moment, we're looking to expand that into additional areas of planning and growth management. And finally, on staff development, which is another key area of recommendation coming out of the work of the consultant, we have put in place a dedicated resource within the department, a senior director who's focused half-time on doing leadership development and training and development within the department. That's Marty Hazel. And some of the work that he has spearheaded in 2015, we now have our first department-wide training and development plan. And we also invested quite heavily in sort of our supervisor manager level through a program called Future Ready that we did in partnership with Mohawk College, taking a group of 21 staff through a fairly intensive training and development program throughout 2015. So turning now to 2016 and some of the highlights to watch for in 2016. Once again, Open for Business will continue to be our major department-wide focus. And we'll continue to be looking at opportunities for process improvements. The continuous improvement team is continuing to meet every month and look at case studies and opportunities for process improvements. A major focus in 2016 will be on the implementation of a lean program. There was a presentation to a GIC a while back on what is lean. We have a consultant from McMaster University working with Bill Jansen to apply the lean methodology to two areas initially, draft plan approvals and site plans. They've just completed some of the process mapping. They're now looking to drill in to look at where we can actually find some target areas for improvement. In March, Council will see the development engineering guidelines, which we hope will provide some clear guidelines to the development industry about what the expectations are for applications that are coming in the door. We have underway the review and rewrite of the business licensing bylaw, which is a fairly extensive undertaking. We're looking to wrap that up in late 2017 and be bringing forward to Council for consideration blocks of schedules at a time that we're looking to see opportunities where we can streamline, where we can do some of the red tape involved in establishing business licenses. And as I mentioned, continuing to work with the Amanda project, that continues to be our focus in terms of technology improvements. The next phase of Amanda in 2016 will be looking at committee of adjustment applications, official plan amendments, zoning bylaw amendments, getting those on the Amanda system, looking at letters of credit in growth management, and starting to lay the groundwork through an upgrade into the Amanda 7 platform, lay the groundwork so we can get into online digital submissions in early 2017. That's our goal. In terms of economic development, as I mentioned, in late Q2, intending to bring forward recommendations for an update to the economic development strategy and action plan. We're doing consultations on that right now. Also bringing forward the review and update to the community improvement plan and some of the urban renewal incentives that go along with that. And then once again, as I said, the arts and culture are going to be a key pillar of that economic development strategy. So we're continuing to roll forward with the implementation of the cultural plan, the update to the public art master plan, the built heritage inventory. Also looking in 2016 at doing a review of the film office recognizing that we're anticipating increased activity levels coming out of that office. So while doing the day-to-day approvals, we're still continuing to look forward to make sure that we're planning ahead for the next wave of development. A big part of that will be our zoning bylaw review for the commercial and mixed-use zoning citywide. We're committed to doing a review of the parkland dedication bylaw, update to the site plan guidelines, looking ahead to a municipal comprehensive review. So what are we going to look at in terms of growth for that 2031 to 2041 horizon? We're expecting the province to release a draft Greenbelt Planning Growth Plan in 2016 that we'll need to respond to. And a number of secondary plans. We're going to be bringing forward the tall building guidelines for Council's consideration. The secondary plan for Elfrida, which is really critical to have those lands shovel-ready by 2021 to accommodate our 2021-2031 growth. And an update to the staging of development plan. And growth management continues to work on the downtown servicing strategy, looking at our servicing needs to accommodate infrastructure in the downtown core. I won't go through this entire list, but there's a number of growth-related infrastructure projects on the work plan for 2016. It includes the block servicing strategies for Fruitland Winona, the construction of the Upper Centennial Sanitary Sewer, a couple more urbanization projects on the books, extension of Arvin Avenue, moving forward with land acquisition for the Waterdown East-West Bypass, and a number of other projects as well are on the growth management books for growth-related infrastructure. And finally, looking at two of the signature projects for the departments, the Waterfront West Harbour and LRT. On the waterfront in West Harbour, our goal is still to move and meet that council direction of having the lands in Pier 7 and 8 shovel-ready by 2018. Major milestones to watch for in 2016, completion of the Pier 7-8 urban design study, and bringing forward the formal development application for the development of the Pier 7-8 lands. The continuation of the infrastructure and servicing program, that's being led by Public Works, of course. And perhaps most significantly, implementation of the real estate disposition strategy. We see that coming forward in 2016. We're bringing forward to Council's consideration the conditions and criteria through which we'll bring those lands to market, and looking to have those lands on the market by the end of 2016. With respects to LRT, in accordance with the council direction from August, the LRT office has now been established within PED. Currently they're working on a report to bring forward in the next couple of weeks to GIC, and that'll look at the financial, staffing, and reporting details for the LRT office. The LRT office budget will have no net levy impact. The costs are covered through the Metrolinx MOU that was discussed at the LRT subcommittee earlier this week. But once approved, the net zero budget will be established and built into the Public Works budget. So for 2016, the major LRT milestones, we're looking at the EA for project design and the development of the project of the PSOS that will form the basis for the RFP. That's the major focus in 2016, and also we'll be beginning the fairly extensive community engagement process very shortly on LRT.
Jason, do you want to just take a breather there for a moment and we'll do some of the speakers that want to speak, because there were slides there that you presented. Would that be all right with committee? I'm going to start with Councillor Farr, then I have Councillor Ferguson, Mayor Eisenberger, and Councillor Green. Councillor Farr.
Right. Appreciate your delivery, Jay, and you probably do want to take a breath, so I'll only be long-winded on my first question. And actually, it may be one that is answered when we get to the building division, but just on slide 3. Through you, Deputy Mayor. I know we had a pretty healthy reserve in the building department. I'm guessing it's even more so now that we had this above $1 billion building permit construction value year again. So I'm wondering where that is and how we're utilizing that healthy reserve created by such success.
So through the chair, I'll ask Ed in a moment to sort of comment on what the current balance is on the enterprise on that reserve. I can tell you when we show the building division slides, there are a couple more areas where we're going to be using that enterprise model to decrease some of the levy impact. So you'll see that when I get to building division, they're actually forecasting a net decrease in the levy impact of that division. But in terms of the reserve balance, I'm going to ask Ed if he can answer that.
Yes, through the chair. The building permit reserve currently stands at about $16 million. It's healthy for all of us. We have used that reserve over the last few years to add more staff to the division to support the department that's open for business network, and we'll be doing more again about the same this year.
Staff, and I understand some technology that you're going to go after as well that will help with efficiencies. Now, if this is later in the presentation, you don't have to. You don't have to give me an expanded answer, but if it's not, could you share how you might be using that for technological purposes as well that would be advantageous to the building division and ultimately to planning and economic development through you?
Yeah, so through the chair, the funds in that reserve have been used for a lot of the Amanda project. So some of the hard costs, the software costs, some of the initial programming costs, to the extent that it's permissible within the policy for that reserve, we are using that to quite significantly to cover the cost of the technology improvements under Amanda.
Is it solely under Amanda, Jason, through you, or is there other technologies that we're able to go after now with that monies?
So through the chairs, it's primarily Amanda. A lot of the work being done to go to digital submissions in 2017. That requires upgrading to a new version of Amanda. The bulk of those costs are being covered through that enterprise model.
So through this reserve, we're able to fund the digital submission. So I'll fast forward because that was going to be my last question through you, Deputy Mayor. How are we in with respect to being at pace with our competitors? I know other cities are using these digital submissions now. How important is it that we get there quicker rather than later?
So through the chair, we started off on this process quite a bit behind where a number of our counterpart municipalities were. There are some municipalities, they say, that are already into digital submissions, that were already using consistent platforms across multiple divisions for processing applications. So we were starting off a fair bit behind, which is why we've been on a very aggressive timeline and have a team dedicated to trying to actually catch up and bring us to sort of state of best practice. So once we get to digital submissions next year, we'll be on par with where the other counterpart municipalities are. I can tell you that the timelines that we're working towards have been extremely aggressive and have required a significant amount of work, but we're keeping to them. And I've actually been very encouraged that we're actually targeting 2017 for digital submissions.
And from a budgetary standpoint, how advantageous is it to have this technology versus, I guess, just a slew of hard copy work being done right now, right?
So through the chair, I'm hoping the greatest benefit is actually going to be seen on this through our partners in the community, through our developer stakeholders, through our business stakeholders, that they're going to find it that they're able to move through the process more efficiently. We'll be able to have better tracking of the applications, better reporting back in terms of where they're at. So I'm hoping that the great benefit is actually going to be in the service level that we can actually offer to our clients.
Great. And just to reiterate, we're able to fund this not from levy, but from this healthy reserve created by the 16 plus million from the over $1 million construction value building permit years we've been having.
Through the chair, the lion's share, yes, there has been some levy dollars in the form of staff, for example, from planning and growth management, who've had to spend some time inputting into the platform and getting it set up. But the lion's share has been funded through the building reserve.
Through you, why can't those staff be paid through this reserve for that work?
Through the chair, so there's limitations on what we can use the building permit revenues for. So it has to be tied to the operation administration of the Ontario Building Code. So there are limitations in terms of if we have planning staff or growth management staff who are coming onto the platform. Some of that staff time that they would need in order to create the templates for how they'll report through Amanda is covered through the regular staff time. That's not charged back to the enterprise model. But as I said, the lion's share, certainly the capital costs, software costs, software upgrades, the lion's share is being covered through the reserve.
Okay. Thank you, Jay. Slide 8. Remind us how many additional staffers. Last year, you came at us with some requests for some additional FTEs, and I think rightly through the budget process, my colleagues and I said, "Yep, we approved it," and it was all to help you be more efficient. I think it was a nod to the efforts that you and your team have been making in going after the, not just saying open for business. We are open for business and making some needed enhancements in terms of FTEs or full-time equivalents in your area. So how many was it again, and how beneficial has it been now that it's been a year? And it seems to me that some of that we're going to really see put into action this coming year from your presentation so far. But if you could just speak generally to where we were there, what that request was, and how that's benefited to date through you.
So through the chair, the key staff positions that were added as enhancements in 2015, I mentioned the Director of Open for Business. So that's the position that Bill Jansen is in. That was a new position, and that's been hugely beneficial just because we actually have someone in the department who can focus exclusively on that. Bill's been coordinating efforts of the continuous improvement team. He's been looking at all the different process improvements, how we actually make those process improvements happen, how we're reporting those back through the subcommittee, and also all of our consultation with some of our, with the BIAs, with the chambers, with developers in the community. A lot of that's being done through Bill. So that's been hugely beneficial. The business facilitators, we had 2 additional business facilitators added. One of those is focused on the rural area, one on small business. So that's sort of an enhanced service that we can now offer. We previously had 3, now we have 5. I mentioned earlier the summer company program under the Small Business Enterprise Center. That was an enhancement. It was a position that was already existing but was made permanent through that investment. So we now have that as a permanent program. And as I'll show in a minute, we've actually been able to now leverage a lot of additional dollars from the province to support that work. We had the Global Hamilton office was another one that was brought forward to make that initially a pilot project, a permanent program. And we had 3 staff added through growth management, through the engineering group and growth management. Then there was a levy enhancement of about $400,000 that was able to give Steve and the planning division some ability to staff up on some of their vacancies. So Steve had reported back on that in GIC a couple of weeks ago. And you're right. I think for the planning vacancy issue, I think we'll start to see a lot of the benefit of that as in 2016. 2015 was very much focused on getting those positions hired, onboarded, and now we have those resources in place. So I hope we'll be able to see those benefits in 2016.
Hired, onboarded, and probably a lot of it training and so forth. So am I hearing, if we could break down your comments just now, through you, Chair, most, if not all, are going to be hitting their stride in 2016 or are already there?
Through the chair, that'd be correct.
Okay, great. Now, on that, training, I've had a few conversations with some of the folks in the community who are always interested in helping us grow, and they're talking about always have opinions on ways we can be more efficient, and I think they appreciate a lot of the initiatives we've made in recent years. But one of the things was struck me, and I said, I'll bring it up at the next budget meeting, and you've mentioned it a few times now, is the staff time doing other things other than what they're paid to do. You mentioned there's a new training sessions that our staff are taking. There's a number of meetings. In fact, oftentimes we councillors will say, we need you tomorrow at 2, and suddenly you're taken away from your job because we've got you 2 hours in room 264 or somewhere else in the building trying to, put out a fire or something like that. Have you got, or did Neville look at this, or will we be hearing about what the breakdown is on staff time away from what it is they actually do? And obviously I'm asking the question in this budget meeting from the standpoint of efficiencies of our staff and getting the job done and getting applications out sooner and this open for business mentality. So is there a breakdown on how much time the average staffer is spending in training, in meetings, whether planned or otherwise, and actually sitting there at the desk or wherever they sit and do the application work they're hired to do?
So through the chair, I couldn't give you off the top of my head what that breakdown would be. We could try to quantify that a little bit. I would say that I recognize there's always that trade-off between you just have people 100% just process files. But I think what came clear, in my own experience and observations, and this was also made extremely clear in the work that Ian Neville had done, is that it's not enough just to throw bodies at a problem. You actually got to invest in actually training those bodies so they can actually provide good service, they can provide good technical advice. So it's, to me, it's not a question of them doing the work they're supposed to do and them doing other sorts of work. I think the training and development that we're investing in is absolutely critical. I don't think that can be looked at as a frill or a nice to have, because the staff's only going to be as effective as the investment that we put into them and the work that they got to do.
And I agree, and I think the individual I'm thinking about, who I had a good conversation about this with, also agrees. It's just the breakdown, like the breakdown on how much time spent here, how much time spent here, how much time spent here. And you know what, offline maybe we can talk about kind of having a look at a matrix to that end somewhere down the line. So I just thought it'd be a good time now to bring it up, because from a budgetary standpoint, we're looking at ways to be more efficient in process applications, quite obviously. And I think truly 2016 is going to be a great year. You're going to start seeing a lot of payoff for some of the initiatives. What is it, 2 years for you now? Through you, Chair? 2.5?
Through the chair, I'm coming close on 2 years. I think I started in May. So
right.
Coming close to 2 years.
And that's the third time you've worn a tie. Finally, I asked.
I'm wearing one, by the way.
No, I know. I wasn't going to make the outfit comment because of the Friday.
You did anyway.
Yeah, I did anyway, didn't I? Anyway, actually, the last question was the online digital service slide, the slide 13. So you've already answered that question. Just hang on a second. Yep, no, I asked. There was a two-part question, and I asked the two-part question already. Thank you. Great presentation. You're a fast talker, but I caught most of it. And congratulations on another good year in 2015 on the building permit.
Councillor,
These guys are more distracting than those doors, by the way.
for your benefit, it's in print. So we'll move on. Councillor Ferguson.
Thank you very much. And I don't have a lot of questions yet because we haven't got to the money part. But I do have one question if you go to slide 8. And if Councillor Rule and Councillor Farr would stop calling my cell phone, I'd appreciate it. Just take it to right there we are. And first of all, congratulations on the numbers. The building permits continue to run very well, which is obviously putting stress on the system. The number of applications processed. I thought the numbers of new downtown dwellings of 900 is an interesting and very positive statistic also. But, and of course, you go through all these numbers here, the 22,000 new housing starts. One that's missing that I always like following, and it's generally in front of us every year because it's a criticism of when we do something like the Airport Employment Growth District, is how many hectares of brownfields we still have. The clear definition of brownfield, which is contaminated, not being used for the purpose of what it was intended, sitting vacant, and in arrears on taxes. We've seen a downward trend, which is a good sign that that land is going back into productive use. Do you have the number of brownfield hectares? Or Neil may have it, so we can just see how that's trending.
To the chair, I don't have that number. I'm not sure if Tony or Neil do. We don't. We can see what we can pull together, though.
I would like to see the trends over the last few years, because I know we track it, and so the last 5 years, what's the trend been like on the number of brownfield hectares? I was always surprised that the average brownfield is less than a hectare, and I'm always surprised that it's primarily old gas stations. And are we able to get addressed at that? And the two big issues we went through the airport employment land were the number of brownfield hectares we had, which, as it turned out, wasn't as high as everybody expected. And the second thing was peak oil, and peak oil doesn't seem to be a problem anymore either. So if they can get that information, I'd appreciate it, Madam Chairman.
Okay, so direction they can get. Councillor, I do have a speaker's list. I'll come back to you second time. Mayor Eisenberger.
Thank you. And if Frugal Fergie could stop going out of the sliding doors there. They're very distracting. I don't know why that's going on, but anyway. The doorman, yes. A great presentation, Jason. Thank you very much. So if I could turn to slide 7, one of the kind of the hallmarks of the efforts that we've made is economic diversification. And I do see that we're rated number 1 in Canada, but I'm not sure that I entirely understand how that rating kind of comes about. So do you have any understanding? I know what diversification is, but what would they come up to? Give us a definition.
Yeah. To respond to that, we've been consistently at the top for a couple of years now.
Right. Which is terrific, I think, but I think it would be helpful to kind of clear picture as to what that means.
We want the maximum level would be a completely diversified economy, and we're that close to achieving that goal.
So when you say, what do you mean?
It means a variety of different industries. Obviously, if you look at a pulp and paper town, different industries and different sectors to shocks in the system like.
Great, thank you. I mean, I don't want to be kind of, is healthy. A broader community that we're actually into for quite some time, but we've for the broader community a reassurance that that we are in fact is helpful. So could you give people a sense that we're actually taking, making significant progress? And I know that we are, but I think it's helpful to communicate that. So could you touch on that a little bit?
Certainly, and through the chair, and actually coming out of the Open for Business subcommittee yesterday, I was kind of sitting down, Bill and I, and trying to think about, okay, now we're going to present back in May. What are the actions we'll present back on? I think we came up with around 20 odd. Forward for conditional site plan approval. Planning Division kind of brought forward and went back to a previous practice of actually being able to have the need for minor variances made a condition of site plan approval. So again, these are sort of small concrete actions that we're making in the process, either to remove steps that maybe are not necessary, or those steps that are necessary, other ways that we can do more of them in parallel and concurrently to shorten those timelines up a bit. So there's a couple off the top of my head. As I said, when Bill and I sat down, we came up with 20 something like that, and at the presentation I come forward in May at GIC, we'll go through a few more of those.
Fantastic. So the more of that you can share, I think, on a regular basis with council and the community at large, I think the better. Because I think people will appreciate the fact that we're actually taking concrete steps to make a significant difference and change in the process and being as good as we can be. So I really appreciate that effort. Last piece is on page 13, and it's about business licensing bylaw review. And one of the so the individual is going to be coming in and has talked to me, and a number have, about not licensed businesses that are out there. So we have obviously a business licensing regime. It's a revenue source as well as a licensing procedure. And the claim is, that they're looking at that at all in terms of what we might do to do some proactive enforcement there.
Yes, so through the chair, a couple of things. In terms of the review and rewrite of the bylaw itself, we'll be looking at. There was some work done looking at this question of, are there a lot of businesses out there who just aren't paying licenses? And we did look at that fairly closely. And I don't know if Marty or Ken off the top of their head can speak to some of the numbers that we found there.
Yes, for you, Madam Chair. Just so you know, there's been a significant focus by our team for an Open for Business process, and they have actually taken on the role of ambassadors to help businesses get licensed. Last year, we laid 266 charges for businesses that didn't comply with the licensing bylaw. We do have the odd business out there that has refused to get licensed, and even though we've laid 20 or 30 charges, they've been able to actually push them through the courts so that they continue to operate. Working with the City Legal Department, we actually have gone through injunctions, and actually yesterday was another court case at Superior Court for an injunction against a business that refused to get licensed. And so we're using not only the tribunal that has been very successful for not great operators of business licenses, but we're also using the courts now if a business refuses to get licensed. But there's been a whole flavor in the licensing department for proactive approach, and all our officers are out there working diligently in their wards to make sure that all businesses are licensed. We do cross-reference checks with all the other databases, including health and fire and police, to look at their information that they have to ensure that licenses are out there or businesses are operating with correct licenses. So is there a lot out there? We don't think there is a lot, but yeah, there's been a whole focus within my division that to find these businesses and help them get licensed, and if they refuse, we'll use the legal system to make sure they do.
So thank you for that, and I appreciate that. So through you, Madam Chair, to Ken, I mean, is it truly proactive enforcement then? You're actually actively out there looking for businesses that may not be licensed and kind of cross-reference them to make sure that they are, and you know what? I mean, I'm hearing that no one's really proactively looking at that. We're working on a complaints basis. So, can you shed a little light on that?
Through you, Madam Chair, not at all. Since I've taken over the licensing department, our whole focus has been proactive. On a regular basis, we do the cross-reference checks between the databases. That actually helps us go out and find premises that are licensed. I know just last summer there was 460 some odd food shops that we found that were not licensed correctly. So they were licensed, but not correctly. So we're doing that on a regular basis. Even this year, we actually have a big map set up in our division, and as officers find these businesses that are operating without a license, and they've served an order, and now it's part of the work plan, they're celebrating it. So there is a whole flavor of proactive work, and certainly we don't work on complaint basis. We work on the proactive way, and if anyone has information, send it to us. We assign it for investigation and very aggressively going after this business.
Thank you very much. Thank you. That's all my questions. I mean, I really appreciate the direction the department is going in terms of the investments we've made, and I think it's starting to pay off. So I'm really delighted with the great positive effects that we're seeing. Thank you.
Thank you, Mr. Mayor. We have a speakers list. I'm going to go next to Councillor Green, then I have Councillor Pasuta, Councillor Collins, Councillor Connolly, and Councillor Marula. Councillor Green.
Thank you very much, Madam Deputy Mayor, and certainly in listening to the previous speakers, I'll segue on the topic of diversification as it relates to open for business and business licensing. Can you comment through you, Madam Deputy Mayor, on the potential use for technology you listed in your slides on how that might be able to improve the process, the time allocations, and potentially the cost for small businesses as it relates to our current licensing model? Just briefly, I'm not expecting the whole overview, but how will technology impact this process that is, as I understand, to be a cost recovery revenue neutral model?
Yeah. Through the chair, so that is the primary intent. The intent, as I said, of digital submissions and the process of improvements we're making generally is to try to provide better service to our applicants, so the businesses coming in. So the hope is, or the intent is, that eventually, once that system's up and running, we can have digital submissions of things like a building permit instead of having to have your drawings in hard copy and come all the way down to City Hall and lay those on the front counter. We'll be able to have those done digitally. We'll be able to have some of the reporting back done to the applicants digitally. And ultimately, what a number of municipalities can do is an applicant can actually track where their application is at in the review process. So is it with planning? Is it with engineering? Is it with building? That's still a little further out, but that's the kind of level of service that we're looking to get to.
And so if you could just for a moment for the public and for the purpose of this presentation, comment on a potential shift towards concurrent processes rather than them being sequential and how that might expedite time.
Yeah, through the chair. So that's one of sort of the, as I said, the two key areas where we're looking at in terms of process improvements. That one is there steps that we can actually eliminate from the process that aren't necessary? Are those steps that we are doing? Are there some that we can do concurrently? So we've looked at building permits and we've made some changes there. We've looked at the linkage between minor variance and site plan, made some changes there. We looked at Form 1 applications, made some changes there. We're continuing to look at where there are other opportunities for that. There are statutes that limit some of that. I mean, there's certain things that you can't do. You can't issue a building permit until you've done certain things. There's no way of getting around that. But what we're looking at is there way things, at least some of the staff review time and some of that back and forth, which is what consumes a lot of the time, can some of that be happening in parallel? But then we also have to be careful so for example, with the concurrent building permits, we're doing that cautiously because if something changes as they're going through the planning process that affects their building permit application, they got to start over again. So there's risk there. There's risk there to the applicants. We want to be clear about that risk when we're offering these concurrent processes.
I think it's fantastic. I know, having sat through that committee, people are anxious. They want to see it. They want to see it now. The challenges with the technology, we're still catching up. So I appreciate the work that's being done there. And I also want to highlight how diversification is really being driven by the smallest business, the mom and pop shops. I think that's, if I were to go out on a limb, I would say that's probably what's driving our #1 ranking in terms of the entrepreneurial spirit of the city. Having said that, on slide 6, if you could for just a moment, I know that we've had some conversation around this in the past. Could you comment briefly through you, Madam Deputy Mayor, or perhaps point me in the direction where it could be made available about this $7.5 million direct spend from film? Is that from a Deloitte study? Is that coming from, how did you get to that number?
Through the chair, so by year end, we are looking at 8.5. I'm going to ask Anne if she can speak to what the metrics are behind that.
Through the chair, I believe it is a provincial model that we use, but I will confirm that with you. As soon as possible, I'll send out an email and get that information to you right away.
If that could be made available, I would really appreciate that. The challenge being, Madam Deputy Mayor, is that it's often coming up. We've heard it here already with user fees on some of the other services as it relates to seed, public health, road closures, paid duty police. The biggest challenge that I'm hearing from BIAs and everybody else, and this is no secret because I've already had this conversation with staff, but I want to say it here today, is that if you go further down that slide, you'll see there's 400 plus special events. It's actually more cumbersome and more costly to run for our community, our volunteers, to run those community events than it is to apply for a film permit at $50. And $50, you can rent the whole park. You could potentially have road closures and all of these things that buckle over into that. And if I'm to understand correctly through you, Madam Deputy Mayor, if Jason or Anna would like to comment on how the film industry has grown perhaps and speak to the pace that it might be overgrowing our current office's capacity, just for a moment.
So through the chair, I'll ask Anna to respond to the first half of that question in a moment. And when I sort of look ahead to some of those 2016 and 2017 pressures, increasing activity through the film office is one of the ones I'll be speaking to. But I'll let Anna respond to the question.
So through the chair, in terms of special events, there is no charge to go through the SEAT process, which brings all the players together in the city to help the event planners with the process. Now, event planners will pay for a fee for park rentals, all of that type of thing, road closures. Very similar to the film permitting, which is $50 per day per location. They have to pay the same park fee rentals, they have to pay the same street closure rentals, they have to pay all of that. So that permit that they receive does not cover anything else other than the administration of putting the permit through.
So then, I appreciate that clarity. Certainly not the perception in the community as they look to, the pressures that this industry is putting on communities and the cost recovery model that we currently have as it relates to the growth of this industry in our city and a potential revenue stream loss, as the mayor just brought out in terms of business licensing. Here's a massive business that oftentimes brings in huge trucks from White's and all the other rental companies out in Toronto, brings in craft services, certainly might spend some time at our hotels. I'm just not clear where the direct spend is. And so I guess I'm asking that when you bring forward those pressures, that we're having a serious conversation around cost recovery as it relates to the fees that we're charging around our film permits, rather than going to the general levy to have the taxpayer subsidize a bedroom industry from Toronto. So those are my comments there, and they're not new comments. I've said that in the past, and I'll probably say it again in the future.
Just going to close on that comment. If Anna, when you prepare that email or report for Councillor Green, make sure that we're all circulated, please. Thank you. I'm going to go on now. Councillor Pasuda.
Thank you, Madam Deputy Mayor Pearson. I'm going to go through a few things here. Hopefully it doesn't take too long. Slide Jason 3, Madam Deputy Mayor. Slide number 4, Jason. So you kind of moved along quickly. Maybe I missed it, but you went through many of those square feet up there, the different companies. But to Parrish and Heimbecker and the G3 Export Grain Terminal, there's close to, $100 million down there. You didn't kind of focus on that. I can tell you that the world of agriculture out there is eyes wide open on what's happening here in Hamilton and the new terminals, particularly when we get into the summer, into the fall, late fall, the harvest of the wheat, the soybeans, and the grain corn. There's always a backup at the terminals we have right now. It's time consuming, it delays harvest in the fields and further can delay harvest and cause grain damage because of weather conditions. So this is a good thing, and as I said, the eyes are wide open in the world of agriculture. And the more we promote this, and Mr. Everson will know this, the more we promote it, the more industry, agriculture related, is going to watch Hamilton and want to move here. So I think we really have to focus on this. And many times I see Hamilton promoted, but I don't see the grain industry and the agriculture industry and the food industry focused enough. We do not put enough focus on that. So just wanted to bring that up. Slide 6, there's tourism on here, and Councillor Green just mentioned that. And I know we have had staff talk about the Juno Awards and the impact in the film industry, as Councillor Green mentioned. Special events we have, and I see farther down we get, and don't go there, but slide 44, 45, 6 and 7 is tourism culture, and looks like there's a shortage of a few dollars there. Are we going to be having a discussion later on about the needs for the tourism and the need for a few dollars down there? Because I think it's related here. Hamilton's expanded. I remember when I was on the tourism board, we're always short of rooms to bring in conventions and that. Thanks to the investors that have come in Hamilton here and building new rooms with the hotels and that, there's an opportunity here, I think a great opportunity for Hamilton to bring in more and promote more. So I don't want to have at this point in time, I'm just saying don't want to shortchange tourism and culture for funds, because I think it's just a big spin-off here. So I don't know if there's any comments on that one there, but do we need to comment now or later on? But I'm really concerned that we need to support tourism here because there's great economic benefits from that. So, Madam Chair, can somebody respond to
Mr.
So through the chair, thanks for the question. And there was, so when the tourism strategy was brought forward in 2015, there was an item referred to this budget process for $350,000 as an enhancement to the tourism budget to provide for some of those costs for attracting conventions, for submitting bids on major events. That $350,000 is not built into this budget yet. That's part of the enhancement discussion, and so I wasn't going to be speaking to that today. I'll just speak to the base operating budget for tourism and culture today. It will be brought forward when we have the enhancement discussion, which I think is next week or the week after. I can't quite recall which GIC budget date that is, but that'll be one of the enhancements in the PED enhancement package.
Okay, on that one, slide number 11, and that's the planning one, and there was council adoption of the rules zoning bylaw. Looking back at it, we went through all that, and then it got appealed, 05-200, there's been an appeal. But I've got properties, I've got businesses out there that went through variances. Then we do the council adoption of 05-200, then it gets appealed. Did we make a mistake in there? Because there was, through the process, because a lot of them got grouped. So I've got businesses, I've got people that want to build a garage, a building for their home-based business who've been captured in this. Why or what did we not do here to sort those out, set them aside so they weren't part of the appeal? I mean, we've got the landscapers that we had, and that got appealed, and then it drew in a whole bunch of the other ones that were on the approval agenda. What, did we do something wrong here? Is there something we could change for another time down the road? Through you, Madam Chair.
So through the chair, I'll ask Steve to respond to the specifics. We do have a report coming, I believe it's on Tuesday, with a status report on the status of those different appeals. But in terms of some of the smaller site specifics, I don't know if Steve can speak to that.
Through you, Madam Chairman. I wouldn't say that we did anything wrong in terms of the first bylaw that was passed. That was citywide, and it was sort of one standard zoning bylaw. Recognizing that there would be some concerns and appeals as it related to the second round of housekeeping amendments, we actually presented to Council multiple bylaws dealing with the various different thematic areas, because we assumed that there would be appeals against the landscape contractors portions of the bylaw, so that bylaw was appealed. Unfortunately, because we had one sort of housekeeping bylaw that would deal with the balance of the items, that bylaw was appealed, and we weren't anticipating appeals to that bylaw. So we tried to break it out to avoid somebody appealing the second round of housekeeping amendments, which would allow them then to proceed. But unfortunately, some people did appeal to that second housekeeping bylaw, and we didn't anticipate those appeals based on the consultation and discussions that we had earlier in the process.
Okay, thank you for that, and I'll just wait for when it comes up down a week or so. Thank you.
Tuesday, we'll be at Planning Committee for a report. Councillor Collins.
Thanks, Madam Chairman. Jason, I've watched with interest certainly the development numbers over the years, and we continue to set almost record levels in terms of building department numbers, construction value, and the like, but it hasn't really translated through you, Madam Chairman, into new taxes for the city. And so our average over the years has been about a 1% growth rate, some years as low as 0.8, 0.7. The numbers we're seeing now are some of the highest we've seen, 1.3. But, you know, when you start to break down the 1.3 number, we're probably looking at about an extra $800,000 to $1 million, you know, extra a year, which isn't a lot of extra resources to invest in whatever area of the organization that we're looking at. So in the past, you've provided, and others, Mr. McCabe before you, have provided a breakdown in terms of where that new growth is coming from. And, you know, we talk a lot about investing in our port and in our airport, and certainly in the downtown. Councillor Pasuta, you know, just highlighted the fact that we have a very strong agricultural community that provides a lot of economic development. So I say that in the context of trying to understand or wondering how we figure out where the new growth resources are coming from. And historically, what we've been advised is that it's coming from new residential growth in the suburban areas. So Councillor Connolly's area is exploding right now above Stony Creek Mountain. Councillor Partridge is experiencing a lot of growth. Before them, Councillor Johnson. And those growth numbers that you've highlighted here today and in the past are essentially coming from single-family or even, you know, row townhouse residential construction on the fringes of the municipality, which is probably not the best type of growth we'd like to see. So I ask a question as it relates to how we can understand where we've been in terms of geo-tracking that assessment, new assessment, and then understanding where we're going with some of the key investments we're making. Councillor Farr and I attended last night, you were there as well, the West Harbour public meeting that is regularly held on James Street North, and a lot of discussion there about growth. So we know that that's one of the key investment areas we've made, and we hope to see some return on our investment, not just in terms of adding on to an already successful neighborhood, but we hope to see dollars come from that in terms of development. So I know there's a big preamble there, but I'm interested to know how we can switch the traditional gears in terms of relying on the construction of single-family homes around the fringes of the municipality to something more meaningful and substantial as it relates to commercial, industrial, or even some of the increased condominium activity we see in downtown and elsewhere in the city. So I know there's kind of a lot there to chew on, but is that possible? And maybe I should be asking Mr. Zagaric as well, but maybe I'll first leave it to you to try to rationalize that.
Sure. Through the chair, I think it is possible to acquire a bit of sort of the information that we have and a bit of the information that Mike has. The slide that I put up here was intended to give a bit of a picture of the geographical distribution. Probably the bottom image is more relevant to your question than the top image. The top image would include a lot of, you know, sheds and those types of things. The bottom image shows construction value per hectare, so that shows where we've got concentrated higher value building permit activity. And you're right that you see a lot in Stony Creek, you see a lot in the downtown, or kind of two of the big anchors, and that's the 2015 picture. We did have the residential sector was unusually strong performer in 2015. It was about 75% of the building permit activity, was higher than the trend has been. We've had typically a higher component of ICI. A lot of that though anchored by a major project. So the past couple of years we benefited from a Maple Leaf, from a hospital, from a Tim Hortons, and that sort of really bumped up our ICI. So you're right, it's dominated by a lot of smaller permits, a lot of permits in the residential sector, which don't necessarily translate into that assessment growth. And one of the challenges that Council's made pretty clear in my department is you want us to focus on growing that non-residential assessment side. So we really are trying to focus on growing that aspect of it.
Yeah, when I look at that map, for as much as we focused all of our energies on the downtown in terms of stemming the tide of what's occurred maybe in the 90s, if you want to make a comparison, and all the time and energy, we have the Bayfront secondary plan going on. We've put millions of dollars, tens of millions of dollars into the waterfront, and you know, when you look at a map like that, it's even the airport. I mean, it's pretty telling in terms of some of the major economic drivers that we have in the city are not generating the new tax revenues that we maybe have hoped to have seen. So I wonder whether there's a way historically to go back maybe a couple of years, create the same cut information here, and then somehow trying to rationalize with some of the investments we're making. LRT is one of the biggest ones we're going to see. If we don't start seeing some of those colored areas along that corridor there, then that's a problem. So if we continue to rely on single-family homes on the fringes, it really isn't doing anyone any favors. So I don't know if there's a way for you and your staff to come back. It's probably something for committee. I ask it in the context of budget because we're talking about revenues today and new assessment growth, but it's probably a good discussion to have either at planning or GIC at some point in time. And I wonder whether Mr. Zagaric has anything to add in terms of how finance can help track that information and assist us with what I see as a problem.
Mr. Zagaric?
Through you, Madam Deputy Mayor, Councillor Collins is correct in terms of if we look back at our assessment growth that we've reported, net assessment growth to this council, last 5 years we've averaged just about 1%. 2010 and last year were our highest levels at about 1.3% assessment growth. In terms of 2015, as Jason identified, in terms of where they're seeing in terms of the building permits, the concentration in terms of sectors, that residential sector, that was what we experienced in terms of assessment growth that we reported 14. In fact, if in terms of 2014, if I can go back to the report that we provided last spring, you may recall that as it relates to that 1.3%, about 1% of that 1.3 was driven by residential growth. A small increase in commercial industrial and a small decline in multi-res. So in terms of that concentration as it relates to, and again, you may recall that ratio that both Jason, the city manager, Chris, and myself have presented in terms of that ratio of unweighted assessment, 77% is residential, 13% is non-residential, and needing to move that non-residential yardstick, we're not seeing that ratio improving. And I don't expect, based on the information that Jason's presented in terms of building permits and the assessment, I don't expect that ratio is going to improve in 2015. It'll likely stay similar at that 77-13%. So the one opportunity is, again, we do break it down by geographic area of the city. If I look back, I have the report we presented in the spring in terms of the wards in 2014 that reported higher than average activity, and especially in the residential sector. It's been wards 9, 11, 12, and 15. Ward 2 did see some higher activity, about 1.6% higher activity. So again, we can look at presenting this information in a different way using maps, and it may be an opportunity to look at all of Council's discretionary policy decisions as well. Earlier through the budget process, we discussed DC exemptions. There may be an opportunity to look at all of our incentive programs and where we're focusing those incentive programs, where there is building activity, where we're seeing the building activity in terms of which sectors, and revisiting those incentive programs to see whether or not there's continued alignment in terms of where we want to focus our discretionary efforts, discretionary financial resources, or whether we need to amend some of those programs.
Sorry, Mike, thank you for that. I didn't catch whether, do you need direction for that, or are you coming back with that already?
So through you, Madam Deputy Mayor, just picking up on our previous conversations around motions and directions, if there were to be a motion and we can track this item in terms of a coordinated effort between planning, corporate services, and any other departments within the city.
Okay.
And I was going to say, through the chair on the incentive question, that is scheduled for, I believe, March GIC. We're coming forward with a report on the CIP and the incentive programs with some recommendations.
Great. Thanks for that. Those are my only questions.
Councillor Collins, I can come back to you for a motion on this, or would you prefer to wait till the GIC? I'll leave it up to you, okay? But I'll come back to you. Thank you. Councillor Conley.
Thank you. Just some information, I guess. Last year we did approve a lot of FTEs. Have they all been hired, and are we full staff now, or are we still searching? Because I know I talked to somebody in the last 3 or 4 months and said, oh, we're still 8 or 9 behind. Is that a reality, or what's we having a hard time finding people, or?
Through the chair, so I'll let Steve speak to some of the details because he did present in some detail at the previous GIC. I can say the challenge is that it's not a question of having trouble finding people, but we have some very good internal candidates, and when we open up positions, more senior positions, we actually have a very good talent pool at the junior and intermediate levels to draw upon, and some of those advance into the senior positions. That opens up a vacancy beneath them. So there's a cycling through that does happen, and then we do have in-year departures for mat leaves or people taking jobs elsewhere. So that sort of has, we're kind of always pushing against that tide. But Steve can speak to in terms of where we're at with the actual numbers that he took to GIC a few weeks ago.
So through you, Madam Chairman, with respect to the Planning Division, last year Council through the budget process approved 2 FTEs in the Business Facilitation Group, specifically for planning, not within the Planning and Economic Development Department. The 2 FTEs that were within the Planning Division, both of those positions have been filled, and those are business facilitators. Is within the overall department, or overall within planning. At the end of last year, or the end of 2014, there was 13 vacancies in planning. We posted 20 positions to fill, 20 postings for 28 positions. We interviewed and attempted to fill as many of those positions as possible, and at the end of the calendar year, we still had 13 vacancies. But we are moving forward on filling additional postings. So this week we're doing periodic postings for some entry-level and intermediate planner positions. We're also going to be advertising for some additional positions shortly in the next few weeks. I think there was an urban designer position also that was recently posted. So from a planning division perspective, we are moving forward and is filling as many positions as we can based on both either their internal candidates or external candidates, and the ability to bring new staff in, to go through the onboarding process, train them, and then get them into their new position. It can take 12 to 18 months for a new person to make that transition, but we are making progress in terms of filling the vacancies within planning.
And through the chair, does that affect the open for business concept? If we haven't got the people to do it, and we're going through this training stage and hiring, does it affect our ability to be efficient with the open for business concept? Through the chair.
Through you, Madam Chairman, the vacancies hurt the ability of staff to deliver in a timely fashion when, essentially within the development planning group at their low point last year, where we're supposed to have 3 development teams, we were effectively, in terms of the number of occupied positions, we were operating with the equivalent to 1 team. Effectively, half of the step positions were vacant within the day-to-day development approvals. So that will affect our ability to process applications in a timely fashion. As we fill those vacancies, it takes a bit of time for staff to make that transition as they learn the policies and the procedures and the way we do business. Most of the staff, or a majority of the staff, are less than 2 years within their current position, and usually it can take somebody up to 12 months to get sort of their sea legs under them and understand the roles and responsibilities with that position. So I think last year may have been sort of a low point in the department in terms of the number of staff we have and the ability to have a timely response to development applications. We've been working to reduce the per planner average file load. I think some planners still are at the 40 range, which is higher than where we want to be, but the majority of the staff are approximately 25 files per planner, and that enables them to continue to move applications forward in a timely fashion. I think just last year was a bit of a transitional year for the division, and moving forward into 2016 and then into 2017, we're a little bit more optimistic in that would be ability to have a timely response to development applications.
Thank you very much for your comments.
Councillor Marula.
Thank you, Madam Chair, and many thanks for the presentation. On the issue of the assessment growth and the ratio to which it's allocated to residential versus industrial and commercial, that's something that has been brought up by year over year as a presenting problem, in that every time the assessment growth occurs for residential purposes, we have to then provide other services, which compounds the challenges and the impact from a general levy perspective. Hence, the focus should and must be, how do we increase the commercial and industrial base, thereby providing us with the necessary finances to subsidize the services in other areas. So, through you, Madam Chair, sometimes what seems to be good news, in essence, could be considered somewhat bad, in that it's providing more pressure on us to provide that necessary service. Having said that, one thing about the LRT, and something that I've been stressing, is the fact that The LRT, through you, Madam Chair, will focus in on trying to bring in the urban professionals that are coming from Toronto presently, but in larger masses, I believe. And in doing so, you're reversing the brain drain locally that has existed for decades, where we lose our professionals to other cities because they're going into those professional capacities. The belief is, and I believe this strongly, through you, Madam Chair, is that where the professionals or where those people are going to be living, the businesses will follow. And some of my relationships and knowing some players at Queen's Park and those by extension at Bay Street are saying just that, not only from an affordability standpoint, but to accommodate their employees to ensure that their commute from home to work is shortened. So through you, Madam Chair, can you elaborate on the LRT, how that will play a role in economic development, and by extension, reversing what really has been, I think, our number one contributing factor to our assessment problem, and that being the reverse of the brain drain the city experiences?
So through the chair, the situation you're describing around employers being attracted to where the talent pool is, that certainly has played out. We've seen evidence of that in our interactions with potential investors in the city. The kinds of questions that Neil and his team are often asked when they've got people sniffing around whether or not they want to locate to Hamilton is they ask questions about land prices and lease rates and those sorts of things, but they're also asking questions about where will their employees live. And one of the competitive advantages we have in Hamilton is we do have a competitive cost of living. And we've got I would say, a pretty wide diversity of housing options, of lifestyle options across the city. So we have seen that as one of our competitive advantages as we're looking to attract employers to the city. With respect to LRT, yes, I agree. I think one of the benefits of the LRT is right now we have a concentration of interest around the downtown core. That's where a lot of the amenities are. That's where the GO stations are. I think one of the benefits of the LRT is it starts to extend the accessibility to those amenities to a broader part of the lower city. I think one of the early things that we're seeing is we're starting to see more interest in student housing in the downtown core, which is something that has been a priority for quite some time. And we're now finally starting to get some uptake on that. And a big reason we're hearing why that's happening is now this future connection from downtown to back via LRT just makes it that much more attractive as a location for student housing. So we're starting to see some uptick on that.
Okay. So on that front, in trying to focus in and selling the city as a destination for corporate industrial developments, I would presume that part of that sell would be emphasizing not only our connection to Toronto, but the fact that professionals are moving to Hamilton in droves, and we have this talent base presently residing in the city. I presume that would be part of the formula in which we're presenting our case.
Through the chair, that is very much a part of the story that we're telling when we're talking to potential business startups. Absolutely.
Okay. And again, with respect to changing channels now to the actual perception of the permit process versus, I think every one of us around this table, and including staff, would say that when you're speaking to the general public about the permit process or planning in general, you're generally receiving very negative reviews because of delays, repeated requests for information, the lack of streamlining. Although we've made some strides towards improving it, I think that perception still exists. And although FTEs might play a role in mitigating those issues, I think the greater problem, and that being some of the cultural issues that presently exist and predate your time here, are still present, not because of the lack of FTEs, but because of the cultural sense of entitlement in some cases. And we're dealing with hundreds of people, so I think everyone understands the politics and the human nature of a work environment. What are we doing internally in order to address those issues from a formal perspective to ensure that we are empowering people and trying to leave the cultural aspects that have contributed to this problem in the past where it belongs, and that is in the past? So through you, Madam Chair, are we focused in on it in a formal manner?
Business, I can tell you that I appreciate that those negative feedback as well. Provides them very little discretion to be able to make one of the reasons why I said the key process improvement in technology, one of them is provides them very little discretion to be able to make.
We have quorum. We're going to continue on with the presentation. Councillor Collins, I'll come back to later when he returns for a motion. Jason, if you want to move on now.
I have to find my place. So this is the snapshot of the overall PED budget. We're looking at a net levy impact department-wide of 2.7%, exclusive of any enhancements, and this represents a $750,000 levy pressure. The primary pressure by far is employee-related expenses. That amounts to just over $1.3 million, which would actually be about a 5% net levy impact, but we were able to offset that pressure with a few positive things. So we are forecasting a slight increase in our revenues through our development application process. The larger increases, we're looking at increase in parking lot revenues forecast based on some rate increases in some lots, some increased usage, increased number of monthly permits sold, so we're forecasting an increase in parking revenues. And as I alluded to earlier, one of the great successes this year of the Small Business Enterprise Center is they're being looked to increasingly by the province as a delivery partner, delivering not just in Hamilton but in some of our neighboring municipalities as well. So we've seen a significant increase in the number of provincial grants flowing through the SBEC, and that resulted in an increase of $167,000 forecast for 2016. So as a result of those offsets on those employee-related increases, we land at that net levy impact of $756,000, or about 2.7%. In terms of some of the challenges looking forward in 2016, well, we don't have any significant increases in the base operating budget. It's just really just employee-related costs that we're looking at. There are a few challenges that I wanted to highlight for council looking out to 2016. One of those is in parking and bylaw services. We have some structural revenue shortfalls in parking and bylaw services that have been carried forward year after year. That was reported to GIC in October. We brought forward a budget variance report to identify where some of those variances were coming from, to identify some of the things that we're working on now to address those variances, but also highlighting some areas where we don't see any likely change happening in the future, and that we'll be bringing forward in the enhancement discussion in a couple of weeks. One of the enhancements we're bringing forward is to deal with some of those structural revenue shortfalls in parking and bylaw services that we don't see rebounding in future years. And to Councillor Pasuda's earlier question, the tourism strategy as well. We're still operating off some reserves that were provided through a transition fund in 2013 from the province when they wrapped up the destination marketing fee wrapped up. So that has not been supplemented in the year since, and we're getting close to the point now where we don't have a significant reserve in order to do some of the investments that we need to continue building the tourism industry in the city. So I can speak more to that in a week or two when we come forward with the enhancements. That is one of the ones, as I said, a $350,000 enhancement was referred at the time of the tourism strategy to this budget discussion, but that's not reflected in the numbers that I'll be showing here today. On development approvals, one of our big challenges is all the open for business stuff I've been talking about, the technology improvements, the process improvements. We're trying to do all of that stuff at the same time. We're also still maintaining very high activity levels of applications coming in the door day after day after day. So that's been one of the stresses, especially in building planning and growth management. Trying to migrate the services onto Amanda, all of that being done while trying to keep up the day-to-day. And then also being able to make sure we're looking ahead to that long-range planning. Because I think one of the key things, if you think back to that building permit map I showed earlier, one of the weaknesses of the building permit as an indicator is it's got a huge lag time. So what we're benefiting from in terms of that building permit activity is the culmination of a lot of planning and infrastructure and growth management work that happened many years ago. So we got to make sure that we're continuing to invest in that sort of long-range planning work so that we can keep that activity going into the future. And this has already been spoken to a couple of times through the Q&As around resourcing. So we have the investments that from 2015 that have allowed us to resource up the department a little bit more. But there's still the challenges with recruiting, training, onboarding, getting all that staff ready, and continuing to manage the workloads of those staff. I thought I'd do sort of a sneak peek ahead to maybe what some of the pressures are we might be anticipating in 2017. Again, none of this is actually reflected in terms of any budget increases or budget enhancements in the 2016 budget. Just wanted to sort of flag for Council a couple of things that we're thinking about as we look ahead to 2017. Two areas in particular where we're seeing increasing activity levels. That's in the seat office, the special events office. It's gone from 286 event applications in 2011 to over 400 today. So a 42% increase in the number of events that we're dealing with. That's a 10% year-over-year growth. And we haven't resourced up that team to deal with those increasing applications. So not suggesting anything in the budget or in the enhancements this budget round. Tourism and Culture is going to be working on a special event strategy that we're going to bring forward to Council to look at how we might tackle these increasing activity levels while still maintaining a good level of service. We'll be looking at how we deliver some of the city-hosted events. We'll be looking at possibly using some of the online submissions for some of the special events permits. And other opportunities to see how we can kind of streamline and be as efficient as we can be in order to deal with some of the increasing activity levels coming in. But I just want to flag that one as one that we're going to be spending some time on in the department this year, seeing how we can deal with those pressures. And the film office has already been discussed. So again, we're seeing high activity levels there. With the low dollar, I anticipate we'll see even more activity levels. So again, we're looking at how we can continue to kind of maintain the investment coming through in that industry while being able to sort of and process the increasing number of permit applications that we might be anticipating. One to flag on reserves. This is a good news story. This was something that I spoke about a lot in the 2015 budget, that historically P&D had relied on reserves to fund a significant number of staff. That was one of the reasons I put before you last budget some of the enhancements. So I can tell you we've made significant improvement there. We're carrying just one staff on reserve right now. There's still one staff person being carried off the development fee stabilization reserve. But by and large, we're in a much more sustainable position in terms of using reserves for what they're meant to be used for, which is to carry us through potential low years. So that's been very good news. And then the implementation of the development approvals process review. So we're going through the lean exercise this year. We're continuing to look at some of the process improvements through the continuous improvement team. Can't anticipate yet what kinds of things we're going to identify through that process, but that could have some implications from a resourcing standpoint as we look ahead to future years. So again, nothing in this current budget related to these issues. I just thought it'd be good to sort of flag for Council some of the issues we're working on in 2016 that we may be talking about come 2017. So with that, I'll go through some of the individual division slides. And I'll start with building. Building, you'll see here, had a net increase in year of 1 FTE. That was for a zoning examiner to deal with the number of requests for zoning verifications coming in. We're seeing a lot more of those coming in. The building division, part of that is because title insurance is no longer necessarily covering whether or not the property is properly zoned. So we're seeing more and more zoning verifications, which is a good thing. We actually strongly encourage people to come through zoning verification because it tends to avoid problems down the line when people buy properties or lease properties that aren't properly zoned. So it's good that those activities are increasing. But Ed, through a previous council direction, has delegated authority to be able to hire staff off the enterprise model if they're not going to have any levy impact. So that explains the one additional FTE in building in 2015. Overall in building, we're forecasting a net decrease in the levy pressure in this division. There was an increase related to employer-related costs of about. We did have an increase in employer-related costs. That's offset by looking at some increased revenues coming through from those zoning verifications, and we also were able to allocate some additional costs off the enterprise model in order to offset some of those pressures. And we've got some reduced costs in terms of maintenance of some of our vehicles. So the result of that is a net decrease in the levy impact coming through building. In economic development, we have no change to the complement in the division. And also looking here at a net decrease in levy impact from economic development. There were increases again related to employer-related costs. That was the primary cost driver in the division. A small decrease in some of the loan fees that were coming in. We had a reduction in application fees in 2015 for some of our smaller grant programs. We reduced some of those application fees, as well as fewer applications in one of our in the larger multi-residential loan program. So that had a small decrease in revenues. This was offset by those provincial grants that I mentioned, so an increase in 167,000 in provincial grants coming through the SBEC. So the net result of that is a decrease on the levy from economic development. Looking at growth management, here we have a net decrease of 1 FTE in growth management. This is one of the 2 positions that are part of that block swales and residential drainage program. So the wrap-up of that pilot project is identified here with the reduction of 1 FTE. As I said, when we have the enhancements discussion, that program is before council to see if council wants to make that a permanent program. If the decision is to make that program permanent, this will go back into the complement, and that minus 1 FTE will go back to a net zero increase in the complement. Overall, the Growth Management Division is largely fee-funded, so it's always had a relatively light impact on the levy. We are looking at an 8.1% net increase, but that's representative of just $75,000 because it is largely fee-funded and it generally doesn't have a high levy impact. Again, this is mostly employer-related. We've got a couple of offsets in terms of some forecasted increase in our lot grading revenues and some of our subdivision processing revenues. Looking at parking and bylaw services, again, we see here a net decrease in FTEs. Again, this is due to the residential drainage and swales program. So the reduction of 1 FTE is reflected here. We also have a decrease in management due to the change of a licensing manager to a supervisor. So that created that's where the minus 1 on the manager's column is coming from. Net levy impact in parking bylaw services of 3.6%. Again, this is exclusive of any enhancements, so that the enhancement discussion to deal with some of the structural revenue shortfalls will be part of the GIC deliberations in a couple of weeks. Most of that, again, is employer-related costs. A few other drivers as well. We did increase this year an additional $50,000 contribution to the parking reserve. The parking reserve was starting to get low. We also have some additional costs in terms of hydro, some of the rents and leases on our parking lots, property taxes paid for our parking facilities, some additional costs for credit card charges through the lots that now take credit cards, fuel costs, and the offset on here is a forecast increase in parking revenues of just over $400,000. In planning, we have no net change in terms of the complement. And once again, our major cost driver in planning division is employer-related costs of about $116,000. Offset, as I said earlier, by a modest forecasted increase in our planning revenues. In tourism and culture, we have no net increase in FTEs. We did have some movement in year in terms of we deleted a manager's position and replaced that with elevating 2 of our project managers to SPMs. So that's why in the management column you see overall a net increase of 1 on the management side. As with the other divisions, employee-related costs are the major driver, about $276,000. We also have some cost increases around snow removal and some of the facility rental charges for Lister Block. And finally, in the GM's office, no net change in terms of complement, and the increases shown are all employee-related costs. So that concludes my presentation.
Okay, thank you, Jason. And I had speakers list, Councillor Collins. Thank you.
Thanks, Madam Chairman. Through you to Jason. Jason, historically we've looked at increased parking fees that either match or just below the private sector rates. And I wonder whether, based on your comments there, there's still room in terms of us investigating, as we did, I believe it might have been last year or the year before, a bump on the off-street lots in terms of a revenue generation. Is there a way to find out whether there's parity right now with the private sector, or whether or not there's some room for additional revenues in that regard through you, Madam Chairman?
Through the chair, I can tell you there's not parity. Our rates are still below what the private off-street lots are. Would need to look into what those exact amounts are, and it would vary because the private lots have various rates, but our rates are lower than the private sector lots.
I would like to investigate then, at least finding what it would mean to get to a position of parity with the private sector, and if I could ask staff to come back. I don't want to do anything on the fly today. If you come back with some information related to some costing, certainly I'd like to know what the downtown councillor thinks. Not all of the lots, but many of them are in the downtown. But certainly based on Councillor Farr's, with his concurrence, then I would move that at the appropriate time.
Okay, I'll come back to you, Councillor. I have Councillor first and then Councillor Farr.
Thank you, Jason. Could you go to slide 34, please? I guess this is the one that jumps off the page most, an 8.1% increase in growth management. But it all seems to turn on this loss of revenue on growth management. And so we budgeted $277,000 in 15. You're budgeting $50,000 less in 16. But this year, we actually had $533,000. So why are you predicting a $300,000 drop from the 2015 actual to the 2016 budget?
So through the chair, the key difference here in 2015 between the actuals and the budgeted relates to gapping on some of the enhancements. So growth management brought in 3 or 4 enhancements that came in later in the year. So that's the difference. In 2016, we'll have those staff on board, so we would actually incur those costs. So there was a savings in terms of the projected actuals. It relates to gapping.
Well, growth management, that's the revenue for fees, that line, isn't it? It shows us a negative number, which would signal to me that's the revenue you're getting on your applications. Am I interpreting that properly?
Through the chair, I'm not sure that's the direct correlation. I'm going to have to look to Tony or Janie if they can answer that, or Mike.
Through you, Madam Deputy Mayor, I'll start and then Tony can expand. So in terms of growth management, I think what's transpiring in that line in 2016 is about $100,000 in employee-related costs due to inflate COLA, as well as collective bargaining. A portion of that is being offset by revenues, but not the full amount. I think about half of that is offset by revenues. So again, hence the pressure of about $55,000. So again, employee-related costs, pressure of about $100,000, and there are revenues that are mitigating about half of that.
So, Mike, when you look at these budget presentations and the numbers have brackets around them, that's good news. That's fees.
So through you, Madam Deputy Mayor, as it relates to that specific service area or section, that would indicate to committee that in terms of the cost of that service, that the revenues are exceeding the cost of the service. So in 2016, there's approximately $222,000 of revenues that are helping to reduce the levy and mitigate the impact to local taxpayers.
So the obvious question is, if you budgeted $277 last year, and I expect you budgeted the enhancements in there in 2015, you actually came in at $533, double that number, as a net profit. But you're taking it down even below the 2015 after having that exceptional 2016, you're taking it down to $54,000 after having that exceptional year in 2015. Are we expecting a slowdown? Is that why that's happening?
So through you, Madam Deputy Mayor, and Jason did address the principal factor in terms of what affected 2015. There were 3 vacancies in that section in 2015. So that increase from what was budgeted in terms of $277,000 favorable to $533,000. That $300,000 differential was related to those 3 vacancies. How we budget is we assume that those positions will be filled at an appropriate salary grade. And so what's reflected in 2016's budget is that those positions would be filled, that the functions will be performed, and at an appropriate salary grade. So that's why you're seeing that difference from 2015 projected actuals to 2016 budget as well as 2015 budget. It was driven by those 3 vacancies.
Okay, I understand that. So either Tony, then do you need to fill all 3, Tony? Because that jumps off the page, a 19.7% increase.
Through the chair, yes. We need the resources. We've got a lot of gapping, and we've actually, some of the stuff was farmed out to assist, but the one number that I want to point out was that the revenues did come in, especially on the lock rating, and we deferred to the year that we have the expected expenditure. So the lock rating fee is collected, for example, at Ed's stage at the building permit, and it gets transferred in, but that expenditure will happen in 2 years down the road once they finish the building. So what we're trying to do is create a sustainable business unit for the lock rate, but as it relates to the vacancies, right now, the staff is extremely challenged in terms of the volume, and what's been going on is we've been, as Jason alluded, we've got to keep planning to allow for this future growth to occur, and some of my infrastructure group has been carrying on the extra workload, and there are other major projects are falling behind, and we need to get that done.
What are the 3 positions, Tony? What do they do?
So those are the review. So we have a vacant project manager's position that does the subdivision review, creates subdivision conditions, and we have 2 vacant coordinators at this current time that do the site plans and prepare the agreements, and along with responding to all the consent applications that come in. So they're very busy.
Okay, I'm glad you brought up the site plan approval or the grading approvals. I know we added 2 staff in that area 2 years ago to help you process that, but I have the situation which your staff are quite familiar with in the Meadowlands where families have to wait 3-4 years in order to put up fences and they have children, or to put on decks because you can't get these site plans approved. With these additional staff, we seem to have fallen behind on that, and I'm getting some nasty emails, as I should, because 4 years after you buy a home, you should be able to put a fence up to keep your kids safe. Any comment on that?
That's through the chair to the councillor. That was one of the issues we raised. There's a pent-up demand of final approved lock rating that hasn't come in. Staff has been trying to chase down the developer. Quite frankly, the developers are we have millions of their dollars that can go back into circulation that they haven't followed up. There's particular 2 developers that they had a change in management that didn't realize that, so we're chasing that up, along with looking at tightening up our requirements in the subdivision agreement for those specific issues related to the homeowners being able to enjoy their property, especially the ones with young families and kids that they want to enclose their backyards so they can actually have that privacy. So,
well, in your mind then, Tony, what's a reasonable amount of time from when a family occupies a home to when they should be able to put their fence up?
Through the chair, that's a very tough question to answer. It all depends on the exact situation. Some of the larger developers, for example, do things in a very methodical order. So they go up one street, down one street, so it comes down in a very timely fashion. And typically upon occupancy, ours takes about 18 months. I think it's about 12 months. They put in their lock rating certificate this fall. We let it go through a season because we know there's going to be settlements between the buildings. So then we go back and re-inspect the following spring and in the summertime. And if there's any deficiencies, they have to fix it up. So they're going to go through a 12-month cycle at least, once they finish the grading.
I would suspect, Madam Chairman, that through you to Tony, that a family moving into their nice new home, with their young family, should be able to put a fence up after 12 months. But they're taking 4 years. And I don't know other members of council in growth areas are getting that same pushback. Boy, oh boy, that Meadowlands area, I got some serious problems there with this stuff had taken 4 years. And I can't answer when they call. I said, that's unreasonable. I agree with them. And I turn it over to your staff to try to deal with it. But it just seems to be a problem that's mushrooming. And then I see you're looking for an 8.1% increase, and you just start to scratch your head. That's just a comment. You don't need to respond to that part. But if you can get on getting these lot gradings approved, I'd appreciate it.
Okay, I'm going to go back to Councillor Collins on, I think now 2 motions. Oh, I'm sorry. My apologies, Councillor Farr. Sorry, on parking.
Right, and I'm anxious to get to his, both of Councillor Collins' motions, so I will be brief. Slide 39, please, Jason. And this is with respect to Councillor Collins' I think, second motion, but one that I fully support. Been always a prevalent conversation in Ward 2 is parking, and more so lately, even at the BIA levels, International Village BIA-J, and I just had back-to-back downtown BIA meetings, and the biggest BIA in the heart of our city, where we had good, fulsome discussions with the business community and the members of that BIA on parking, and a lot of it is in their BIA, and much of it on the periphery too. So, actually, our manager of parking ops and maintenance, his official title, Ted Arnold, joined me at the last meeting, and he was very helpful. We're on one of the standout comparisons, and essentially what we're looking for, and hopefully I can have a friendly amendment to add to what we're looking for from Councillor Collins in just a few moments, is we actually, to park in downtown Hamilton, roughly folks are paying what you're paying to park in downtown North Bay. So you get a real good deal from our municipality as it stands to park downtown, and a lot of folks in the ward have reminded me over the last few years especially, it's a heck of a lot cheaper to park monthly than it is to actually own a bus pass. So that's an interesting little tidbit as well, and when recently we've asked TDM and parking to get together and meet and talk about ways to find some synergies and work together, that's probably part of the conversation. So I'm up for, and in advance, I have shared these conversations with the BIAs, especially looking at ways we can solve some problems in parking and address costs. So comparing to private lots locally, absolutely. I know what'll come back. They are a little more. We're a lot less in some cases, but I think what we're going to find is that the private lots kind of jump on whatever we do. So if we do something, they're going to piggyback or change their business model. But we'll wait for that. That'll be in a couple of weeks, I guess. But if we could also compare to our comparators out there. So I mentioned North Bay as a reference, but there's some other cities. So is that something that we may already have, Jason, or something that Ted can include when we report back in a couple of weeks?
Through the chair, yes, that's relatively easily done. It's tracked through OMBI, and you're right, we are typically one of the lowest, if not the lowest, in terms of our on-street parking rates, so those numbers could be pulled together relatively easily.
And through you, Chair, we had a downtown parking review, 5-year review not long ago. Maybe there's elements of that would be helpful as well when you report back. And for example, maybe the latest update on our waiting list. I'm sure they've grown at these lots that we're going to have a closer look at through Councillor Collins' motion. So can we get that information as well? Because I mean, one of the interesting conversations we had at the last BIA meeting, and to some extent the first one when we've tackled this question about the cost of municipal parking, was related to what we're hopefully going to get back in this report. So is there a way we can look at the supply and demand element, basically?
Yes, through the chair, we can certainly include in that report back what is the current waiting list on the municipal lots.
Okay, thank you. And just one final comment on it, because again, I deal with it every day and every level, and I think Councillor Collins, he wasn't at all hesitant. We've talked about this in advance many times in the last few months, as a matter of fact, and we've been working on this together, and we appreciate Marty and Ted and yourself and getting involved with a greater conversation that ultimately in a few weeks will be, I'm sure, very public, and a lot of people will have a lot to say as we try to address this in a prudent fashion. But when you look at slide 39 and you see the major cost drivers, you know, a lot of those bullets are parking related. You got a parking reserve that you had to throw $50K at because it's depleting. You have an increase in what we're paying staff. You have the increase in the rent in the parking lot. You got an increase in the credit card charges, which will only grow if we do what I think most people want, to have the convenience of sliding a card, which is essentially in its infancy at City Hall, notwithstanding some councillors looking for it many, many years ago, and the credit card charges will just continue to grow. So we have to, I think this is a good time, this budget session, to approach a greater conversation on how to look at parking and parking revenues going forward. So I'll look forward to that, and if I can have a friendly amendment, or if we can just understand through the direction I've just given our general manager of planning and economic development, that we include not only a comparison, Councillor Collins, to what the private lots are doing with how they react to what we charge, but also look at comparators at a greater level across the province. Thanks.
Thank you. Before I go to Councillor Collins, appreciate that. And I think in the context as well, if I'm not mistaken, we have some reports coming forward with regards to surplus surface parking lots and rezoning. So that could also impact the picture coming forward that has to be kept in that radar. Councillor Collins, I'm going to come back to you now.
So it's moved by myself and seconded by Councillor Farr, or I don't know. This is the first one that we talked about earlier, that staff prepare a presentation and report to committee highlighting the historical geographic trends related to new assessment and supplemental growth. The other one is that staff be directed to investigate the feasibility of raising city parking rates on off-street parking lots in parity with the private sector and report back to the GIC during the 2016 budget process, including the information that was referenced by Councillor Farr as the friendly amendment.
That's seconded by Councillor Farr. So his friendly amendment's been included. Councillor Farr, yours has been included. Everything's all right. All moved and seconded. All in favor? Carried. Thank you, everyone. Thank you, Jason. I think that completes the planning presentation. Appreciate that. Now I do have bare quorum here, and I thank everyone for that. We do have a private and confidential matter today that's been added to the agenda. Therefore, I'm going to please ask for a motion to move into closed session respecting a personnel matter pursuant to Section 8.1, subsection B of the City's Procedural Bylaw 14-300 and Section 239, bracket 2, subsection B of the Ontario Municipal Act 2001, as amended. The subject matter pertains to personal matters about an identifiable individual, including city employees. Moved by Councillor Partridge, second by Councillor Pursuit. All in favor? Carried. We'll give the